We'll get started. Welcome to the Minnesota Board of Animal Health quarterly meeting in April. This meeting has been posted in all of the appropriate places. We'll start with introductions. It sounds like I think we have one more board member that we're waiting on. So I am Chair Erica Sawatzke. I'm a turkey producer from this part of the state. So it was not a bad drive this morning.
Dr. Vivian Hawkins, livestock producer, livestock veterinarian. I have animals, mostly swine. And I live in Northfield, Minnesota. And skip you, or is that can I keep going?
Okay. I'm Dr. Abigail Maynard. I am a small animal veterinarian. I live in St. Hello, I'm Dr. Katie Cornell. I'm a senior veterinarian for Board of Animal Health, covering cattle diseases, animal disease traceability, and livestock concentration points. Minneapolis. Hi, I'm Stacy Eissinger. I am the new general counsel for the Board of Animal Health. First meeting, thank you. I'm Shauna Voss. I'm a senior veterinarian with the Board of Animal Health, and I oversee poultry programs. I live here in Wilmer, so welcome everybody. And we look forward to providing a tour for you.
I'm Dr. Eric Job, Assistant Director at the Board of Mental Health, and I oversee all the senior veterinarians and programs.
Morning, Luke Shostrom, Executive Director of the Minnesota Milk Producers Association, also live 37 minutes north of here, so thank you very much for coming to this side, and thank you for those in the metro. We'll be you back, we promise.
Ashley Coles, Executive Director for the Minnesota Turkey Growers Association. I do just live 40 minutes from here, so pleasure to meet.
Morning, I'm Erin Kreider, the Communications Specialist at the board.
I'm Paul Anderson. I'm the chair of the MVMA Small Animal Welfare Committee, and I'm also involved with the elk producers and the Minnesota pet breeders.
I'm Dan Yellhan, I'm a Communications Specialist with the board.
I'm Crystal Ansbacher. I work with poultry programs under Dr. Voss at the board. Chris Allen, Danny, the supervisor for the board. I hail from Lidstrom right now, so the 2.5-hour drive. Kind of relaxing.
I'm Lawrence Brock. I'm in OAS for the poultry for the board, and I work in the poultry program.
Allison Pollock, Minnesota Board of Animal Health at the NPCL Wilmer and Poultry Program.
I am Stacey Holzbauer. I was the Deputy State Public Health Veterinarian until February 1st, and Shauna Voss retired, and so I am the new appointed State Public Health Veterinarian.
Brian Gates, Minnesota State Veterinarian and Executive Director for the Minnesota Board of Animal Health.
Rovira, I'm the interim director of the Veterinary Diagnostic Laboratory at the University of Minnesota.
Hi, I'm Steve Neal. I'm a cattle producer, board member, Northfield.
I am Alex Stady, a member of Shockman Washington Sioux Committee and cattle producer and board member.
Brenda Harkov with the Minnesota Elk Breeders Association, also owns Thunder Ridge Elk Farm in Howard Lake, Minnesota.
Elaine Hanson, Minnesota Pet Breeders Association.
Brian Zimmer, Ag Advisor for the Animal Health.
Terry Sisted, a consultant for the Animal Health.
Brian Parch, I'm one of the senior vets overseeing companion animal programs, rabies, and violations. Gina Ford, county officer. And Lisa Lutz, I'm working HR for the board. Morning, Melissa Smith, business manager for the Minnesota Board of Animal Health.
Got some new faces here today, so it's good to see some of the people that work for the board that we haven't met before. So thanks for coming. At this time, I'll be looking for an approval of the minutes from the December 6th meeting.
We approve the minutes.
Been motion, is there a second? Been second, any discussion? Any discussion, any discussion? All approved, please say aye.
Aye.
All same sign. Motion carries. Is there an approval for the agenda for this meeting?
So moved.
So the motion, is there a second? There's a second. Any discussion? Any discussion? Any discussion? All in favor, please say aye. Aye. Opposed, same sign. Motion carries. Right, Brian, that looks like you're up.
Hey, Erin. Yeah, can we ask if Dr. Fox is on? She was going to try and jump on from time to time, but it may be inconsistent.
Dr. Fox, are you on the meeting today?
She may not be at the moment, but okay.
We'll keep an eye out for her.
Well, Aaron's getting my PowerPoint ready. I just had a couple of kind of odds and ends things. It's always hard to give you updates when I know I've got other people that are giving you more in-depth updates later in the meeting. So just a couple of things. Staff related, we're pretty excited to have Stacy join us as our general counsel. Ecstatic, probably is a better way. And dare I say, we're probably inundating her with work already. So it's been a great addition, and we are very pleased to have our own general counsel, and especially having Stacy in that role. So more to come from Stacy, based on the rulemaking process and those kinds of things that she'll be working on. Michelle will be giving some updates on our legislative agenda. I think Dr. Wheeler got a message out to all of you about field visits with board members and paired you up. So looking forward to hearing how those visits go. And then I kind of wanted to take advantage of where we are and who we're with. So it's probably fortuitous that we have this meeting in Wilmer, because honestly, the board's activities since the last board meeting have been fairly all-encompassing poultry. So it's no secret, High Path has really been on our plate for the most part. So it's great that we're in poultry country. And I want to give a shout out to I want to give a shout out to our poultry staff. So Shauna, Laura, Allie, Krista, amazing group. They keep us rolling. It's not been easy, and they keep the program going. They keep the industry going. I gotta say, I'm reminded every time I'm on a national meeting, there's no better place to be. This sounds weird, but if you're gonna have a poultry disease and a devastating one, there's no better place to be than Minnesota. We have unique partnerships here with University of Minnesota, the Diagnostic Lab, NPTL, the USDA, that you just don't see anywhere else. And I hear it every month on National Assembly calls with other state veterinarians. The things that they deal with are pretty remedial compared to what we deal with. And it's because we have these great partnerships. So just, it bears repeating. I said it before, but I wanted to bring that up again. So with that, I'm going to give you a little update on High Path. Aaron, is this?
Yeah, it works.
All right, so this is just kind of a breakdown of where we're at. So I mentioned this twice already, and I probably should say it again, but High Path has been pretty quiet for the last month. So a good time to kind of regroup. We certainly don't expect that trend to continue, but just to give you an idea of what the board and our partners have been dealing with for this fall outbreak. So here's the numbers comparing to the overall event. So this is still considered part of the 2022 High Path event, just because there wasn't a clean cut nationwide, so it continued. But we've got a breakdown of what we actually dealt with this fall in Minnesota. So 39 confirmed cases, 1 dangerous contact, 1 presumptive positive, and then 20 negative suspects. This is a chart that Lucy Hunt has put together for us and kind of reports to us weekly. And I was curious about that last number in particular. I wanted to know how much testing, surveillance we're doing of suspect cases that actually come back negative, just to give you the impression and the understanding that we don't just test what we think is going to absolutely be high fat. We test suspects that may or may not be, but in lieu of the situation, we want to make sure that we are doing our due diligence. Here's a graph that you guys are kind of familiar with. We show this fairly often, but this is kind of the trend, the number of cases throughout the fall. So starting October 6th and then up to our current date. It just gives you kind of how those spikes are where we had the largest number of cases, and then it's kind of a cumulative total up to just about 40, so 39 total. But you can kind of see where the spike was in November, and then we had a few blips in December as well. Another heavy graph kind of showing the same thing. This is dating all the way back to the spring of 2022. So you can see the huge spike we had back then. As you recall, we had another round in the fall of 22. And then curiously, spring of 23 was relatively quiet. And then at the far end is our fall of 23 event, just to give you perspective of what this kind of looked like. Obviously, the spring 2022 event was the most intense. We had a little more of a trickle in the fall of 22, and then I guess somewhere in the middle. I wouldn't call it a trickle. It seemed like we were inundated, not with the same number of cases that we had in the spring, but it was an intense fall. Heat map just showing the counties affected with high fat cases for the duration of this incident. And then this map shows our positive cases, and the pink ones, pink stars, are the most recent ones. So just to kind of wrap up where things are at, all control areas are now closed and the associated surveillance is done. So we are doing continued surveillance in those control areas. Thanks, Krista, for a great job at that. There are 2 remaining premises with active composting. So still getting their piles through that series. Once the compost is released and the barns are cleaned and disinfected, then the environmental samplers come in. So we have 3 sites pending environmental sampling. And we expect all of the barns to be sampled by the end of February. And once they're cleared by labs, all the quarantines of those affected sites can be lifted and restocking can occur. So another thing I got to point out, this doesn't happen in other states. How rapidly we get these control areas cleared up, surveillance is wrapped up, and getting barns back in business. It's not done that quickly in other states. So again, kudos to everyone who's working on this. Cost is something that we need to talk a little bit about too. So the number of hours that staff has dedicated, regular hours, and what it's cost the agency, a little over 4,000 hours, and the cost is a little over $250,000 for regular hours. Then overtime hours, just about 850, with nearly 50,000 in overtime hours paid out.
Hey, Brian, that's just labor time. Is there additional cost to?
Yeah, this is just payroll. Yeah. Any questions on high fat?
I'm gonna ask on the payroll thing. That's payroll we normally would have had for the people who work with this, or is that above and beyond
So the
extra people moved in?
the way payroll is done, we designate where those hours are being placed. So we've got people in programs outside of the poultry program that are dedicated to the high fat response. So then their salary is coming out of that bucket, so to speak, or it's attributed to those hours spent on the response. So while they're regular hours, they're not necessarily regular duties that the staff is doing. So, but great question, because then Then the question has to be, so what happens to the time that's not getting spent on the regular job, so. Other questions?
Oh, that's fun that it comes out of, how does that get punished?
I would
Is
have,
it- I mean, is that like legislative funds or?
I have to ask Melissa, where did she go? Oh.
Yeah, so we designate a certain budget each year for, HPAI. And that comes out of our general appropriation that we.
So yeah, it's not specifically allocated by the legislature for that. That's what we do internally. Shauna, did I miss anything on the, we're good, okay. All right, Erica asked me to give a little update on the swine program as well. So we've got some stuff cooking there as you can imagine with our US Swine Health Improvement Plan, US SHIP. So this is what our current tallies are for enrollment. So 4 studs, we have 4 boar studs with a capacity of 804, 108 breeding farms with a capacity of 367,516. Growing sites, a little over 1,200 with just shy of 4 million. I thought we were going to hit the 4 million mark with capacity, but we will probably do that by the end of this month. Fair to finish sites, 18 with about 60,000 capacity. Small holding, 22 at about 13,000 capacity. 1 non-commercial site with 20. 1 packing plant with 7,000 capacity, and currently no live animal marketing enrollees.
Can you explain your at number when you talk about capacity?
Yeah, so that's the first number is number of sites. So if I'm looking at fair to finish, for example, we've got 18 sites that have fair to finish operations. Total capacity of those sites is 60,000 animals.
So that at number, like the 60,000 is just on 1 farm?
That's the total.
That's the total?
That's a total for all.
Total, okay.
All
Great,
18.
great. Okay. Thank you.
Yep. Some other things going on with US SHIP. So we're partnering with Minnesota Pork, and they've contracted with Dr. Tom Wetzel to kind of help us improve our enrollment. So we had a lag last year in enrollments for whatever reason. It's the program had a big splash the first year, but I think there's a lot of field work that goes on. It's hard to get people to kind of complete the application. So Minnesota Pork offered to help with that, and Dr. Wetzel in particular has been going around and checking in with some of these sites that we've got part of the enrollment, but not the entire enrollment, to get them to complete it. So that's part of what he's done. He's also developed a little more of a strategy to reach out to swine veterinarians. So we kind of went for the low hanging fruit the first year for enrollments, which means we tapped into all the big companies and were able to get them enrolled. We missed out on a lot of our contract growers, independent growers. So that's the direction that Dr. Wetzel's been going. Specifically working with some of the swine veterinary clinics to reach out to those people and actually help them enroll, working with their staff to get the enrollment package done. And then also I'm identifying some of those underrepresented groups. So from the last slide, I had mentioned, we had one packing plant. Well, we've got more packing plants in Minnesota, so there's opportunities to get more of those on board. Live animal marketing is a new group that we hadn't had until recently. So that's a new division that was voted in, and that's going to be kind of what it sounds like: markets, buying stations, that kind of thing, just to get them registered so we know where they are. So they're part of the picture if we get to a traceability kind of situation. Non-commercial would represent more of those show pig kinds of settings. And then small holdings are facilities that have, it's commercial facility, but it's a small, like 100 or fewer animals. So they don't represent the largest portion of the industry, but we want to be using this program to its fullest extent. So the more we get involved, the more aspects that can be represented, the better it is for everyone. A couple of pilot programs that are part of the US SHIP resolutions have included Minnesota as a state that's working on. So 13 other states along with Minnesota, are working on these two programs. One is to develop an interstate movement kind of reservoir, so movements relative to growing, breeding, exhibition, to just determine that we can dump these into kind of a centralized location and have access to them readily if we need to trace something back. We already have the system in place at the state level, so we can trace movements. It's part of Dr. Pardill's traceability program. But the idea with this was it would be easier to access. If we can get into the database and just pull it out without having to track it down from the producer, it would save a step. The two formats that are being used in the pilot are AgView and RAPAP. So a couple of databases that allow for tracking and reporting movement records. The second pilot is movement of live swine to slaughter facilities. So similar, but kind of being able to trace those right to the end of production, basically. The format that was used to collect that data was the format that we used for our swine production health plans. So I think I've talked about these before. These are, we call them commuter agreements, and it's a unique program that we have for some livestock that allows these animals to move without individual identification if they follow certain parameters. So, for example, with pigs, it would mean a group of pigs is selected from birth, basically, or from weaning. And they are identified as a group that will continue through their production cycle throughout life. So we don't have to individually identify those pigs because they will always be together. They will never be commingled, and we can trace them based on movements from the farm that are reported weekly. So the bigger picture is we can maybe even eliminate some of the data entry that goes along with that program. If it can be deposited into one of these repositories, then we have access to that information and we don't have to have the people sending those in. So that pilot begins this week. So we'll see how things go. We're going to give it a run for a couple months and see where things happen, where things fall afterwards. Additionally, we're still looking into another initiative that was brought forth at USDA. I mentioned this before, where they're looking for a centralized repository for premise ID numbers to be placed that identify this is a SHIP certified site, and it gives regulators an opportunity to pull the pin and determine if they're participating. We have an issue with that in Minnesota because it's contrary to some of our state privacy laws. So one of the first projects I handed over to Stacy was to work with the USDA folks and some of the attorneys in Iowa that have worked on the same concern on their end to determine, is there a route to include Minnesota in on this? How do we do it legally? How do we do it without being negligent to that state privacy law? So we're still working on that, trying to determine how to have that happen, and then also figure out what's the actual purpose. So we already have stipulations where we can do that in a case where it helps preserve animal health, or if there's an animal emergency, we can release that information. This doesn't constitute that. This is peacetime, so it's a little harder to justify that we would be able to provide that information. All right, and that's what I got for updates. Any questions? Thank you.
Thanks, Brian. Do we have Michelle ready?
Sometimes I just like.
Morning. Can you guys hear me?
Yeah.
Can you guys hear me?
Yes.
Okay, perfect. Thank you. Okay. Hi, everyone. Medina. I serve as the Director of Government Relations for the Department of Ag and also for the Board of Animal Health. So I have just a quick legislative update for you all. As you probably know, session will start here this coming Monday. So it'll be the first day of session. We are in the second year of the biennium, which means that this year is primarily a policy year. Last year was a budget year, and now we're into policy. So There'll be policy. Additionally, there'll be some bonding and there will be some sort of supplemental budget. We're not sure what will be available for the supplemental budget yet. We'll know more when the February forecast comes out. So we're waiting to kind of see with that. So because we're in the second year, it means that all the bills were introduced last session are now still available for this session. So that means all of those 6,705 bills that were introduced last session are all still available for this upcoming session, in addition to the new bills that will be introduced on top of those. We'll have quite a few bills to be following the session, quite a bit of tracking with that. Just a quick reminder of the times and where the committees meet. So the main committees obviously we'll be tracking for the board is the House Ag Committee. That meets on Tuesdays and Thursdays from 1 p.m. to 2:30 p.m. and 1:20 in the Capitol. Senate Ag meets Monday and Wednesday from 3 to 5 in the Minnesota Senate Building. That's from 11:50. And then the House Environment is Tuesdays and Wednesdays from 3 to 4:30 in the State Office Building in room 200. And then the Senate Environment and Natural Resources Committee is Tuesday, Thursday from 3 to 5 p.m. in 11:50 in the Minnesota Senate Building. So we kind of expect there to be a pretty busy session, a lot of things going on. Again, really the focus is on policy, but there will be some budget conversations and that. Thankfully, we're sitting pretty good in our Ag emergency account. That account lives at the Department of Ag, but we share that with the board. So we are fully funded there at the moment, which is definitely a good thing. One other thing I wanted to mention too was the board members at some point will need to be confirmed by the Senate. They're Senate confirmable. We're not sure when that date will be, but we'll follow up with the board members on that. I know Dr. Peggy Hawkins has her term has ended, but she can stay on the board until July 1 of 2024. We're hoping the governor's office will do a reappointment before then, but just checked on that, so she is good there. And I think that is all I have. Does anyone have any questions? We're gonna get pretty busy here with this new session start. Oh, the last day should be May 20th is my understanding. So again, a very short session. Probably gonna get a lot done pretty quickly here.
Michelle, this is Erica. Can you hear me?
Yep.
Could you maybe just briefly explain Senate confirmation to our new board members that'll have to happen too? What does that mean?
Yeah, so I'm still working on figuring that out. So I'm pretty sure if I remember correctly from the last confirmations that we went through, they are confirmed first in the Senate Ag Committee. And then I believe they go to the floor of the Senate, but it's been a while. I'm in touch with the governor's office of what that is, but I believe that's what it is. So you just come before the committee, essentially testify, talk about your position in the board, your background in ag, and then they'll confirm, I believe, in the Senate committee and then on the floor as well. But I will have more details on that. I'm looking into it still. But that's for all members who have not been confirmed yet. And I think there's a number of you that need to still be confirmed.
You went through that right there.
I did.
Okay. Take that.
Yes, I have to do it. The unofficial January,
Right.
my thing ended, but I get to stick around until July. Until somebody replaces me or I replace me.
America, but I physically want to say fall.
I actually did mine on during COVID, yeah, so I didn't have to drive into the Capitol, I just did it over, like Teams, whatever. So, it wasn't bad, I mean, they ask you, just kind of to tell them about your farming background. And then they'll ask you a few additional questions, I mean, it was pretty conversational, so not intimidating. I didn't think that it was intimidating, at all, but they're not out to get you. They're looking for your information, your background information and kind of like why you applied to be on the board, like what's your interest?
And we can.
Can I just step in just for a little thing here? I don't know if everybody needs to hear this, but I've never seen a thing like that happen. And somebody was supposed to go first and then they weren't there online. So I wound up going first. What I didn't know is you only address the chairman, not the person who's asking the question. And it all has to go to the chairman, and the chairman will tell you to talk. And they'll tell the person who ask a question, then they'll tell you to answer. And Erica got on and did that like she's. And after I saw that, I went, I was pretty naive. Wow.
Michelle will work with you all
Yeah.
and give you kind of orientation on
Yeah. I wish I
exactly
had
stuff.
that.
Yeah, I was gonna say, before any of us do that, maybe if there's a little bit of coaching, but, I say that it's not intimidating, but I've been involved with the turkey growers doing Poultry Days at the Capitol, so I've watched committees before and the procedure that, that you're supposed to talk. So I knew that, and I kind of took that for granted. Sorry. Thank you. But a little bit of coaching maybe from Michelle would be, beneficial and wanted. So.
So Michelle mentioned that you will talk about your role in ag, and you mentioned your role in farming, but I'm the companion.
Yep.
So do I still have to have some background in ag and farming?
Nope, it would be your background as a small animal
Okay.
veterinarian. Yep, so my background as a farmer, is why I'm on the board, and your background as a small animal veterinarian is why you're on the board.
Thank you.
So, yes, yep, you're welcome.
It's, yeah, so they can confirm that you're suited for the role that you're applying to on the board, so just.
Okay.
Yeah, and we can definitely do a training. We do individual ones if you'd like. Just let me know. Not a problem. It's very intimidating at first. I still don't like doing it. I much prefer to let other expert staff testify whenever I can. But yeah, we can definitely work on that ahead of time. And as soon as I know when it's on the calendar, I'll let all the board members know as well, so they can plan accordingly. I would assume they're going to be more so in person this year, just because we've gone more to an in-person legislature. There is still some remote testifying options. So when we get closer, we'll just kind of figure out those details.
Any other questions for Michelle? Thanks, Michelle.
Yeah, thanks. I'll have more to update next time when new bills and stuff are out. So thanks, everyone.
We have Stephan.
Is Stefan online?
There she is.
Yes, yes. Thank you so much, board, for having me. I'm going to share my screen here really quickly. And is there a setting that's not allowing me to include my sound when I'm sharing?
There should be a checkbox that you can check
Yeah,
before you share.
Yep, it wouldn't let me Okay, all right. I had a video I wanted to play. But here, let me try one more thing really quickly. I'm sorry. Okay, can you guys hear me through my speakers now? I have my Bluetooth on.
Yes. Yes.
Okay. Yes. All right, that was the problem, is I was, wouldn't share it through my Bluetooth. Okay, which makes sense. All right. Once again, thank you all for having me. I'm Stephan Schaefbauer, the area veterinarian in charge for APHIS Veterinary Services in Minnesota. So sorry I can't be there with you all today, but thank you for allowing me to present virtually. The first item I wanted to go over or talk about a little bit is our National Bio and Agro Defense Facility, or NBAF. It's been a long time in the making, this lab being built in Kansas. It's going to be the first of its kind for BSL-4 containment that is for large livestock. It'll replace our 68-year-old facility, Plum Island, which was much needed. If you all have been to Plum Island, I feel like those 68 years were kind of catching up with them. And it's located in Manhattan, Kansas. I think it's really interesting, this lab is needed to protect our $1.1 trillion agriculture sector. And so it's a really important lab to have, and we've already established that with Plum Island, but this lab will allow us to do even more. And so I'm going to try to switch over here to this quick video.
Serious animal diseases can threaten our food supply, agricultural economy, and even public health. According to the World Health Organization, more than 70% of new and emerging infectious diseases in humans are zoonotic, which means that they can transfer from animals to humans.
The National Bio and Agro-Defense Facility, which is owned and operated by the U.S. Department of Agriculture, is working to protect our livestock, food supply, and public health from transboundary, emerging, and zoonotic animal diseases.
NBAF, as it's called, has biosafety level 2, 3, and 4 laboratories. BSL-4 laboratories require the highest level of safety and security protocols and equipment, so USDA scientists can safely study and develop vaccines and diagnostics for a variety of high-consequence animal pathogens. There are only a few facilities in the world that have a BSL-4 with the capacity to house large livestock. Before NBAF, U.S. scientists had to rely on other countries' facilities to work with zoonotic and emerging diseases. NBAF is a critical component of USDA's priority to develop vaccines and countermeasures, as well as the early detection of diseases that threaten our livestock. In addition, NBAF scientists will collaborate with industry and academic partners to transfer research into veterinary medical countermeasures used to prevent or fight animal disease outbreaks around the world. Located in America's heartland, NBAF scientists are working for a safer and more resilient America through this world-class science facility.
All right. Get back to my PowerPoint. All right. And Plum Island was the highest level it went was BSL 3 Ag. And so we really are fortunate that NBAF will be a BSL 4 lab, have that capacity as well. Dr. Hoefs gave you a picture of High Path in Minnesota. I'm going to give you a quick, just national picture. So this is within the last 30 days, confirmed flocks. And so it's 21 over the last 30 days, 8 in commercial, 13 in backyard. But if you look back to detections by month, you'll see that the winter months when we were experiencing cases, other places were too. We had quite a bit of cases. Of course, it wasn't as much as the previous year, but it's still quite a bit of activity, especially in California. And so this thing, I'm sorry. Oh, the same with, here's a map showing just the states that were impacted the last 30 days. And this is all flocks, both commercial and backyard. My next update, I wanted to talk to you all about 2 of our internship opportunities. The first one is the Salty Wilson internship. This is more so just kind of making sure that not only the board, but our stakeholders are aware of these opportunities. And so the Salty Wilson, a little bit about Dr. Wilson, he was he was in the 2nd graduating class for vet school at Tuskegee. He was a veterinarian. Had a master's of public health from Harvard. One of his keystone accomplishments was playing an integral part in eradicating foot and mouth disease from Mexico. And he spent, a lot of his time in APHIS, but also at Tuskegee. And so APHIS honored him with naming this internship after him. And it's an internship for veterinary students interested in veterinary medicine or biomedical sciences that provides up to 7,500 per year for undergrad and 15,000 for graduate studies for vet school for tuition, books, tutors, fees. These students also get paid during the summer and school breaks. They get to participate in the retirement system, get vacation and sick leave. And I think, you know, the other thing that's really important are these students get a chance to convert into a position with USDA non-competitively. So it's a great program. We'll see it coming out through USA Jobs in about, it should be in next month. And so if you all know of any students that might be interested in applying, please connect them with me. I know Dr. Karina Berger has also helped students in the past with their application packets and has been successful. And so you have the resources here for our students to get into that program. The other program is the Daniel Salmon internship. Dr. Salmon, also a veterinarian, you probably know his name. He discovered, or however you call it, salmonella. It's named after him. He was the first veterinarian to get a degree from Cornell. And he was also the first chief veterinary officer for, it was I think the Animal Industry Board at the time, but what's known as Veterinary Services today. The program is exactly the same. Same amount of money, except this internship is for non-veterinary fields of study. And so once again, if you know college students who are in human resources or accounting or, you know, you name it, just anything that's not veterinary, this would be a good internship program for them. And they also have the possibility of conversion without competing. I mean, it's kind of nice to sign up for an internship program, get scholarship money, have your summer experiences, and then have a job at the end of all that. So both these programs are fantastic. And then my last update is a hiring update, and it's a bleak one, unfortunately. And so whereas I think the board, if I'm not mistaken, it's fully staffed and has been really successful in staffing, we have not been. And so there's 5 positions vacant. My program assistant position, I actually am in the process of hiring, so fingers crossed that, that will go well. But I have a VMO position that's still vacant, along with 2 animal health technician positions, both in our South team. Neither one are budgeted for right now, which is just really hard. It's just hard on our team. And then the Ready Response Corvette, we had 2 positions that we could get. Unfortunately, one declined, and the other one, we kind of had to go back to the drawing board. They were having trouble moving back to the United States. We had been in talks and working with that veterinarian for almost a year. And finally, we'll have to re-announce that position. And so I'm still hopeful that we might get a Ready Response Core Veterinarian, and that's our new program that just gives us more capacity for high path, is really why those positions were created. And so, yeah, I wish I had better news. That's it for my updates. Chair Sawatzke, I'll turn it back over.
Thank you. Do we have any questions for Stephan? Don't see any. Thank you, Stephan.
Okay, thank you.
We're ready for you.
Okay, thank you. Hi, good. Might have to turn it on.
All right, can everyone hear me? Excellent. Good morning, everyone, and thank you again to the board for allowing me to represent the Minnesota Department of Health and give an update. My name is Stacey Holzbauer. I am a veterinarian and have been the Deputy State Public Health Veterinarian since 2014, but have recently moved into the position of State Public Health Veterinarian. And so I'm just going to give some personnel updates and then just two quick reviews of two diseases that are reportable to the Minnesota Department of Health, rabies and histoplasmosis. So first, starting with Dr. Joni Sheftel, retired on February 1st. After 22 years of being the state public health veterinarian. So many thanks to the folks that were able to attend her retirement party. And this is our crew, our zoonotic disease unit with Joni. And our goal is to continue on her legacy of collaboration and cooperation at the animal human interface. So please, she is not going away. She will definitely be around, but please let us know how we can continue on carrying on her legacy. And so moving on to rabies, this is actually our quote unquote quiet time of the year. So we just wanted to share some of our summary data. And so our rabies surveillance is really our classic One Health surveillance, which is a collaboration between colleagues at the University of Minnesota Veterinary Diagnostic Lab, the Minnesota Department of Health's Public Health Laboratory, our MPH Zoonotic Disease Unit, and the Minnesota Board of Animal Health. And we all work together to carry off this classic One Health surveillance with quarterly meetings where we all gather to talk about issues and ensure that our surveillance is running smoothly. And so in 2023, we had 2,370 animals that were submitted for rabies testing. And so when we look at the past 10 years of data, we test a lot of animals for rabies. And so our companion animals, dogs and cats, make up a huge proportion. And these are usually the results of animal bite issues, which are not themselves reportable in the state of Minnesota, but it's often a reason that animals are tested for rabies. And then bats, which is one of our rabies reservoirs here in Minnesota, also make up a huge portion of what we test. But most of the animals that we test are actually negative, except when we look at skunks, which is our terrestrial rabies reservoir here in Minnesota. And approximately 50% of the skunks that we test are positive. And so when we look at our trends over the years, bats and skunks, because they are the natural carriers of rabies, really drive what we see in other animal species. And as the amount of rabies in skunks has gone down, we see essentially a precipitous drop also in our domestic animal species, such as cattle, that are more likely to be interacting with these positive animals. So then we see the proportion of our positives in bats making up more of what we see on a yearly basis. And so when we look at bats specifically, we call kind of August, September our bat month. This is when we see migration of bats, we see more human-bat interactions, and this is when our toes are ringing off the hook about bat exposures. And it's also when we have the most bats that are submitted, but we do see bat submissions all year round, and we do see positive bats every year. And so looking at the last year, very similar, we tested, most of the animals that we tested were negative. However, we do have other categories that animals fall into. We had 122 animals that were considered unsatisfactory. So these are animals where the brain was not intact, either from being too decayed by the time the animal was submitted to the veterinary diagnostic lab, or injury through how the animal was euthanized. And then we also have animals that are just not tested. They are not considered a rabies reservoir, and so we don't test them. But we had 48 animals that were positive. And so when we break them down by species, we again see that bats make up the majority of the positive animals that we had. We had one positive dog that resulted in 4 human exposures and recommendations for rabies post-exposure prophylaxis. This dog actually had a tangle with a skunk about 3 months prior. But we also had 3 cows that were positive, including 2 cattle that ended up through an investigation with our Board of Animal Health and cooperation with our South Dakota Veterinary Diagnostic colleagues. They were in the same county and the timing was very close. So we were actually able to get the actual virus and sequence it and show that they were actually exposed to the same skunk. And then the investigation showed that they actually originated from the same auction barn and likely came from the same farm.
Actual cows or young stock, can you share or confirm or?
I believe these were young stock. I think they were steers, if I remember correctly.
It was 6 months old.
Yes.
Calves. They were calves.
Yes.
Thank you.
Thanks. And then we also had one fisher as well that was positive. And so unlike our kind of normal years where we tend to see a peak in animal submissions and animal calls in September and in August, we actually had a peak this year in October. Over 22% of our positive animals were actually submitted in October, which is about 2 months later than what we normally see. And we also had kind of, as far as the calls that we get about rabies exposure, definitely extended far into the fall, past what we normally expect to see. So it was an extended rabies year this year. And so we just wanted to share a little bit more about the rabbit fisher, because this was an unusual animal for us. And so this submission came from Waukesha County in Minnesota. And if you're familiar with fishers, they're in the weasel species, or weasel family. And so they're similar to weasels or martins, and they tend not to interact with people. And, they're carnivorous animals that hang out in the forest, kind of minding their own business. But that was not the case with this animal. And so there was essentially an adult woman who was visiting her daughter, and she was leaving to go hop into her car. And as she was walking out in the middle of the night, this animal lunged at her. And so then she came running back into the house, and then this is what her and her daughter saw. But he kept trying to get in through the sliding glass door and biting at the glass. And so they called the police department, who then euthanized the animal. And because fishers are protected species, the DNR was also involved. And so they submitted this animal for rabies testing. And our lab was able to confirm that it was infected with a skunk strain of rabies. But that was an interesting case that we haven't seen here anytime recently. And then, moving on to histoplasmosis. So histoplasma is one of the 2 endemic fungal infections that we track at the Minnesota Department of Health. Blastomycosis is the other one, which is reportable both in animals and in people. However, histoplasmosis is only reportable to us in people, but we do see cases in animals, and we'll get occasional reports as well. But it's found in the soil, and it's often associated with bird or bat droppings. And so if you have a large buildup, because you have a bat colony in your attic, or when people are tearing down old barns or old buildings, or in cave situations, they can potentially be exposed to this fungus. And so it is essentially in a mold form in the environment, but if you breathe it in, it then it turns into a yeast form where it can then divide and kind of become disseminated throughout the body. And so histoplasma can be found worldwide, but there are areas where it's more endemic than others. And so in North America, there's overlap with the blastomyces endemic range as well. So kind of the Mississippi and Ohio river valleys are where we see both of these fungi. And so when we compare what we see with blastomycosis, where we see human cases in Minnesota with our histoplasmosis cases, we actually do see a little bit of a difference. Our blastomycosis cases tend to be in the northeastern portions of Minnesota, whereas histoplasmosis tends to be more in the southwest regions of Minnesota. But there's definitely overlap with these two fungal infections. And so when people become infected with histoplasmosis, they tend to have kind of subclinical flu-like symptoms, and it's often a self-limiting disease. But when they do have symptomatic infections, it can present as kind of an influenza-like illness, fever, cough, difficulty breathing, often pneumonia is diagnosed. And these are infections that can't be treated with antibiotics. So that's usually the first line of defense that when people present with community-acquired pneumonia, they'll be given antibiotics. And so these patients tend to come back to healthcare again and again and again. But the fungus can also go throughout the entire body and create incidental lung nodules or enlarged lymph nodes in the chest cavity or disseminate infections. And so sometimes these persons will actually be misdiagnosed with metastatic cancer or things like that because of the way that their lungs look. There's multiple diagnostic tests that are available for diagnosing these infections. However, some tests are better than others. And fungal cultures, which are great at diagnosing them, take several months for them to come back. And so often that can be a problem in diagnosing. And so treatment is antifungal medications, but you do need your provider to think about a fungal infection. And so we see about 187 cases per year that are reported to the health department. Whether they're confirmed or probable is essentially based on the diagnostic test that is used. And we do see a male predominance. So about 60% of the cases we see are males. And when we look at their pre-existing conditions, we see a large percentage, almost 40% of these cases are actually taking immunosuppressive meds. And so that makes them more susceptible to these infections. And then having asthma is also another potential risk factor. And so this organism is often associated with, fat guano, poultry feces, but when we actually ask our cases, we don't see a lot of them actually reporting that type of exposure. They tend to have less specific exposures, such as, digging in the soil, gardening or landscaping, entering a barn, which may be a proxy for having the type of fecal exposure, but demolition and renovation. And we actually had a very sad situation where we had two retired brothers who were renovating an old farmhouse that had a bad guano, massive amounts of bad guano, and they both ended up getting infected, and unfortunately neither one survived the infection. And so the prevention that you can do, because there's no way for us to eradicate it from the soil, is essentially just minimizing the aerosolization of this fungus. And so if you're immunocompromised, we would recommend doing some of these high-risk activities, although gardening is pretty universal in our Minnesota population. But recommending using professional companies who have the equipment to be able to deal with these, bad infestation cleanups, And NIOSH actually has pretty extensive guidelines on the types of personal protective equipment that you should wear when you're working in these situations, and also recommending minimizing aerosols and spread. So essentially wetting down the material and then making sure you're wearing full PPE, including an N95, goggles, and protective gear. And so that is all I have, and happy to take any questions.
Welcome.
Thank you.
Okay, are you ready?
Morning, everyone.
Sure.
I'm Albert Rovira. I'm currently the interim director of the Diagnostic Laboratory for the next 6 days. New director is coming next week. And I missed the last meeting, but Dean Mulgar gave an update on the PDL last meeting, and it wasn't too long ago, it was only 2 months ago. So a lot of the things that she presented, they still apply. I was looking at what updates can I give you for the last couple of months on the DDL, and maybe give you a little bit of different information from what we usually talk about. One of the things that I didn't include here.
Can you just check if your microphone is on?
Is that any better? Okay.
Thank you.
All right. One of the things that I didn't include here, and I'm glad to see that others are covering it, is HiPath AI. So we've been still busy with HiPath AI, maybe not with new cases, but and you will have the opportunity later to tour the MPPL, so you'll learn plenty about that. But there are a couple of other things that I can give you an update on. First of all, personnel. Like I said, our new director is starting next week, so that's very exciting. He will be in this meeting in April in person, so we're already planning for that. So he will be able to meet most of you in person in a couple months, but he will be starting next week. Another important position that we have open is the poultry diagnostician position. The search is going well. I'm not part of the committee, but what they tell me is they had a very good pool of applicants. They did several Zoom interviews, and they selected 2 candidates that are going to come in for interviews in person. That's going to happen at the end of February, beginning of March. So that's very exciting. That we have 2 very strong candidates for that position. So that's going well. And then 2 other positions that I wanted to highlight is we have some VDL IT positions opening soon too. We have every project that we try to do now at the VDL, every improvement has an IT component, and we have a backlog of IT projects that they just don't get done because there's always something else that's more important. So we're hoping that by bringing some more IT professionals, we're going to be able to actually get stuff done faster. And those they're not open, but will be open very soon. So that's in terms of personnel. In terms of equipment, the big news from the last couple of months is this guy here. This is a generator that is being installed at MPPL, the road to the building later. This is to prevent impact of blackouts, brownouts that happen relatively frequently in this area to the operations of the lab. It's something that we've been wanting to do for quite a while, and with the funding that we got from the legislature, we were able to purchase this generator for the lab. It's not hooked up yet, but coming up very soon. So other ongoing projects. we are still preparing for the AABOD audit. This is the organization that certifies us every 5 years, and it's they are coming up on September to do a full audit on our labs, and that requires some preparation. So we're working on that. We've talked about the tissue digester before. I'm not gonna get into details, but just wanted to mention that we're still working on this. The university at different levels is working on this. There's 2 engineering companies involved, 1 architectural company involved. It is very complicated, a very complicated project, but it's moving forward. We need every 2 weeks, and there's always new stuff to keep designing and developing and so on. It doesn't only affect the digester area, but it's also going to affect, if you've ever been at our location in St. Paul, it's going to affect the dog area and the necropsy area. So it's a pretty complicated project that we're still working on, and we will for the next month. We're working on an online submission form that it's the prototype is almost done. And we currently have one, but it's very antiquated. For years, we've been wanting to update it. And we finally, this winter, were able to put some good time from a lot of people involved at the lab into this. Right now, we're working on the prototype for swine and poultry. And what this means is that people will, to send samples to us, they will still be able to use our paper forms. But if they want to, they will also be able to use an online form that will sign up to their account and fill out the information on that particular case, send it to us. We will get it directly, and then they will send the samples the same way they are sending them now. But we will have all the information being transmitted through the online submission form. This will also give clients the opportunity to put in their farm information, to have templates, and we hope that it's going to make it a lot easier to send the right information to us. Another project that that is very important, we're very excited to see moving forward, is bringing back CWD IUC to the DDL. This is something that we stopped doing at some time. It is important for the state. I know it is important for the deer and elk producers. It is important on many levels. Unfortunately, we were not able to bring it back as quickly as I wanted to due to staffing problems. But now we have built a team in the histology lab, which is the lab that completes the testing, that we think we can bring it back this summer, which usually in the summer we don't have a lot of samples, and be completely ready for the fall, which is when we get the majority of samples for CWD. So that's exciting. That also affects the pathologists that need to do the reading of the slides for this test. And so the pathologists are preparing on their side, the histology section is preparing on their side. We're going through some training, support from MBSL. So it's, even though we used to do it, it's not exactly the same people are going to be doing it. And so it's a little bit involved, but we're seeing progress, and I'm very, very excited about this. And finally, at NPTL, we're looking at what improvements can be done in salmonella serotyping. And so this is something, again, that we've been thinking about, and hopefully if HiPath.ai gives us a break, we will have time to hopefully put some work into this and get some momentum here. Some of the reagents for the traditional salmonella serotyping that's part of NPAP are becoming very expensive, hard to acquire, and there are other methods that might be alternatives. So we're going to be looking into alternative methods and see what could work for the state, for the programs, and see if we can find a good alternative. All right, and then just a couple more things I wanted to mention today. We usually talk about HiPath.ai, reportable disease, and I wanted to list this here. We're still doing work on ASF, foot-and-mouth disease, PRV, brucella, HiPath.ai, like I mentioned. We had a case of mycoplasma syndrome in turkeys. We've had a case of canine blastomycosis, canine influenza. Those are reportable. We had tularemia in a cat. And other times when I come to this meeting, we try to cover this. I think a lot of the interactions with the board about these diseases that are reportable. Today I wanted to mention as well, and sometimes I talk about the more regular domestic diseases, birds in pigs, BVD in cattle, that we do a large volume. Today I wanted to highlight a lot of other stuff that happens at the VDL, and just started getting examples of things that we do. As you know, we do a lot of necropsies, we do a lot of disease investigations, and some of these are the regular stuff, the regular diseases. And some of these are one-offs, but they are all important. And so I just wanted to bring to your attention some examples of what we've been working on just in the last few months. And some of these are pretty unusual, but still, it's stuff that we find with more or less certain frequency at the lab. So for example, on top, we're looking at cases of Glasserella parasitoides. That's a pathogen of pigs that is a bacterium that doesn't, depending on how you detect it, it looks like Glasserella. Depending on how you try to detect it, it will look more like Actinobacillus indolphus. So it got really confusing. And we saw a couple of cases of that. What we did is we sequenced the whole genome of that bacteria, and we found out that it's actually a mix. This bacterium is a mix, has part of the genome from Glasserella and part from Actinobacillus indolphus. Not very relevant for that particular case. It's not causing a lot of disease, but it's causing confusion in the interpretation of the case. So that's one of the type of investigations we do. The second right there, Erysipelatris Isicarius. There's an erysipelas in pigs that Russopatria, different species that is very important in pigs. And this one, we didn't know about this one. What happened was we found lesions in the skin of pigs that look like erysipelas, but we isolated this instead. And we think in this particular case, again, we sequenced it, we characterized it, and we think in this particular case is a producer that also grows fish, and there might have been jump of a species from the fish to the pigs in that particular case. Probably doesn't apply to a lot of people are producers, but something unusual that we find, and we go all the way to try to figure out what it is that is causing that. And in this case, it wasn't the classical erysipelas. We've had cases of mortality in sows that we've been able to tie to Clostridium hemolyticum. Again, that diagnosis, depending on the test that we use, would give us an answer or a different answer. We had to sequence the whole genome of that bacterium, so that was pretty well. We believe the problem has been solved in that particular farm that had the problem. We're currently investigating cases of hemorrhagic tracheitis in pigs, and here I cannot tell you which bacteria or which virus we think is causing this, because we don't have an answer yet. Every now and then, this tracheitis shows up. We're trying to figure out what viruses are there. We found a virus, a coronavirus. We don't know for sure that that is the cause. We're digging a little deeper and trying to figure out if there are other factors that contribute to this. Again, it's not affecting a lot of people. It's mainly one producer in this case, but we're investigating. We found a case of a typical porcine pestivirus in pigs. This is a virus that causes tremors, affects usually newborn piglets or very, very young piglets. What's different in this case is that we found it in growing pigs that develop tremors. And we thought it would be something else, but this is what we found. And so it looks like the disease that happens very early in piglets, but we're seeing it in finishing pigs. So we're trying to figure out, okay, this is really what it is, and why is it acting this way in this particular farm? Again, so far affecting one farm, but it's still important to try to get to the bottom of it. Not only viruses and bacteria, we're also seeing cases of nutritional bone disease in growing pigs. So investigating what could be the problem, what's in the diet that's not working. It's not always as simple as calcium and phosphorus and vitamin D, so it might be one of those, but trying to figure out what else might be there. We're looking at a case of ear lesions and increased mortality in cows. This is very unusual. A couple of the pathologists have been looking at this case and they haven't seen anything like this before. This is very early, but we're investigating what this might be and whether it's a coincidence that there's mortality and there happens to be ear lesions as well. So again, I don't have a cost identified for this, but we're working on it. The next one, I put a question mark there, a typical canine infectious respiratory disease. This is something that veterinarians are seeing especially in other parts of other states. We have not seen it at the DDL, but we're looking for it. We're ready to see if we see any cases that look like this. It's something that people are investigating. They don't really know exactly what it is. But we have our eyes open to see if we identify any of these. As early as yesterday, I checked with the companion animal pathologist. Have you seen any cases like this? They have not. Remember, we usually get the really bad cases that come for necropsy, so that doesn't mean that it's not there, but we are not seeing it. But it's one thing that we're looking for. We're seeing some cases and investigating some cases of leptospirosis in opossums, and in companion animal, we've seen unfortunately several cases lately of animal abuse and neglect in different species. That was a lot of information, but my goal with this was to show you not just the regulatory disease, but all the range of things that we do at the DDL and all the species that we touch. Of course, I don't have the birds here, and we're in Wilmar, but we talked plenty about hypophagia and other diseases of poultry. All right, and my last slide, and this one is about birds. We have been following the development of the detection of avian metapneumovirus in the East Coast first, subtype D that we thought was not here in the United States, and then more recently subtype A in California. B appears to be in turkeys and chickens. A appears to be in turkeys for sure. We don't know if it's in chickens or not. We have tests for avian metapneumovirus subtype C, but not for A and B, and it doesn't look like the test for C is going to cross the act. So we're in the process of developing tests or bringing in tests that are already commercially available for A and B. And we would like to bring in PCR, ELISA, and virus isolation. We're in contact with MDSL about this new virus. We order positive controls from MDSL so we can validate the tests that we're developing. So this is very, very recent. And I'll probably today talk to some of you about how to coordinate this effort. But this is something that we're working on. We've been working on in the last couple of weeks. All right, so that's it for the DDL. I'm supposed to give you the update of the whole college as well, but I'll stop here and ask if you have any questions about the DDL part.
Are you guys testing for COVID through deer at all? Because I know, like, for our tribe, and I don't know if it's your department, we were working with the University of Minnesota to see if deer can contract COVID. So I don't know if that's under your department or if that's under somebody else.
Yeah, it's not as, there are research projects that are looking at COVID in deer, and I believe they are collaborating with the genomics center at the university that they took together a service to test for COVID, so I think they're doing it that way. We're in conversations with one of the professionals that does it to see whether we do it or not, and whether we do part of it at the lab or not. We can test for COVID, but from the beginning, the agreement was that when we wanted to test for COVID, we needed to get approval from the Department of Health and the Board of Animal Health. So it's been very occasional that we test for COVID. So when we have, most of them have been cats, but when we have a case where we want to test for COVID, we would reach out to the Department of Health, Board of Animal Health, hey, we want to test for COVID in this case, because this is the reason why, and you usually get an okay test for that particular case, and that's it. This has been very different in every state and every diagnostic laboratory. Some states have wanted to test a lot, others not as much. That's how we've been handling that, but for the DR, it's a different group at the university.
Okay. Thank you.
Any other questions? All right, so moving on. This is the update from the College of Veterinary Medicine. So a couple months ago, Dean Mulgar gave the update for the PDL. Now it's my turn to give her update. Full disclosure, I'm not very familiar with a lot of all these topics, so I'll do my best. But I'll be happy to gather more information if there are questions that I can answer. We're going to cover just 4 different things. First is the class of 2028. We were just done with interviews for DVM candidates. There were more than 1,500 applications, more than 400 interviews, and that's a record. We've never had that many. And so now the next step is to put together all the results and see who is going to get verbal offers out of those candidates that interviewed. SDSU, as you know, is our partner in training first and second year students, cohort over there. And they also set a record of 239 applicants for the, I believe, 20 seats that they had. So that's promising. I've never participated in those interviews, but I've been told it's a lot of work by a lot of people at the college that they interview a bunch of students, and they've seen that this project works really well. This process works really well. Next topic that we wanted to give an update is the Minnesota Rural Veterinarian Loan Repayment Program for this year. So we're in the process of selecting the 7th cohort of the recipients for this program. So far, 30 VMs have received support, and most of them have remained in rural practices. That's the purpose of the program. And they're looking at potential changes to the eligibility criteria to make it available to more people. So some ideas are to drop the U of M graduate requirement, so graduates from other colleges will be able to apply. To expand to 5 years post-graduation, I believe right now it's at 3 years post-graduation. To decrease the required percentage of time spent on livestock and make it 20 instead of 50%. The MDNA is also working to request additional funds to either award more funding to the same number of recipients, or the same funding to a larger number of recipients, so they can get more impact out of this program.
Can I ask you a question?
Yep, go ahead.
So changing the time of livestock from 50% to 20%. Why is that being discussed? I mean, is it an incentive to those applicants? And the reason that I ask that is because it seems like there's a shortage of large animal veterinarians, making it, like, for me as a producer, hard to find So why is it important? Or what's the reasoning behind, going down on that percentage, that time?
Yeah, and if I may.
Yeah.
Just piggyback on that, and I think the perception would be, so tell me, and I think, Ms. Sawatzke, if we're wrong, but the perception would be also the return on investment of your veterinary degree is much lower on livestock, which is the need for this. So I think my perception would be livestock groups would have very difficult time supporting this change because we hear that the companion animal return on your investment is much greater. But if that's wrong, please let us know. Obviously, we want more veterinarians, but that's the perception I'm hearing, and I think that's consistent with what you're saying also.
Yeah, and again, these are not set in stone, they are ideas that they are talking about. I believe, again, not an expert on this, I haven't been on this conversation. I believe, the reasoning for that is, the concept of mixed animal veterinarian that they do, work in a clinic in rural Minnesota, but they don't have access to this program. And so there's been some discussion about, well, we also need those folks. We also need those veterinarians that do part-time livestock, part-time companion animal that touch everything. And maybe we're just not capturing those. But again, it's not, it's not set in stone. It's just one of the things that they're talking about. But I'm happy certainly to find more information for you.
This is MVMA, or this is MVMA and the college, or what are?
MVMA and college.
I just had a question, Albert, what number of applicants you're getting? And maybe that's what's driving the change, if there's not a large enough applicant pool that they're trying to expand it to get more?
Yeah, I don't know the number of applicants that we're getting. I think it's also related to the last bullet point there, the idea of trying to get even more funds, and whether those are used to get more applicants or more money to the same number, more awards, or more money to the same number of awards. And I think it's a little bit all related, but I don't know the numbers of applicants that we're getting. So this is obviously related. The college is working with MDMA on the issue of veterinary shortages at different levels. So there's the issue of veterinary shortage for livestock veterinarians and for food animal veterinarians. Companion animal veterinarians, they see it too. And for us, for the academic veterinarians, the College of Veterinary Medicine, we see that, well, we have more than 10 faculty openings, and including some of them that we haven't been able to recruit for 2 to 3 years. And so there's openings in imaging, surgery, anesthesiology, dentistry, specialties that is really hard to find veterinarians. But at the same time, more universities are planning on opening vet schools, and so there's going to be more competition for those professionals as well. So there's certainly a concern about that in academia, as well as in other areas. So what the college is doing about the veterinary shortage, we increase the class size through the SESU partnership. We'll continue to encourage food animal practice through the Vet Fast program. This is a program where certain candidates to the veterinary college, they can come in instead of with a 4-year degree, they can come in after 3 years of college to try to expedite if they have an interest in food animal medicine. And we're working again with NDMA on the rural veterinarian loan repayment program to continue that and to grow it. And so finally, an update on the MDMA legislative initiatives. The college is working with MDMA, and I was told that this is where we're at, but things are happening as we speak, so things are changing very quickly. But what are the things that are being talked about for this current year? there's an interest in looking at veterinary technicians and their licensure, and I think this involves what veterinary technicians can and cannot do on their own and under supervision of a veterinarian, and what are all the things that the veterinary technicians are allowed to do to help again with that veterinary shortage. There is an interest in trying to change the description of the institutional licensure for veterinarians. And this is so that we can hire some of these positions at the college that we're having so much trouble hiring by hiring veterinarians that maybe were not trained in the US or they don't have a license to practice in the state. They could obtain an institutional licensure to perform their job at the university only. And this is the way that a lot of states are doing it, but our state is not exactly like that. So it's creating problems to hire some of these specialists that are hard to find. Other things, there's an interest in creating a Minnesota Rural Veterinary Technician Loan Repayment Program. So that would be for veterinary technicians, similar to what exists already for rural veterinarians. And there is an interest in proposing something that helps not the veterinarian or the technician, but the practice, the rural practice. So that's another way to look at it, that they are discussing, well, should we support those practices that are having a hard time hiring veterinarians in rural areas. And finally, there's an interest in a Minnesota veterinary student with animals summer internship program in Minnesota to have more veterinary students actually spend some time in these areas that might be veterinarians when they graduate. Last one, there's an interest in including the veterinary medical education at the college in the governor's task force on academic health. I'm not very familiar with this one, so if you have questions about this one, I'll have to write it down and get back to you. So those are all the legislative initiatives, and that's what I have for you here for an update for the College of Veterinarians. Questions? Feel free to ask. That's it. Even if I don't know the answer, I'll get back to you.
I was just gonna ask for you or anyone else in the room, is that perception correct that companion animal would be higher margin, higher return on investment, or that perception potentially wrong?
I can share my own personal story. So I was an animal veterinarian for the first 10.5 years of my career. I worked in a very, very rural area in Tennessee. I was probably working around 80 hours a week, doing on call for both small and large animals. We were the only practice at some emergency call for 3 months. And what I was making in that job, working twice the amount of time that I would know was half the amount that I'm making as a small. The sheer toll it took on me and my quality of life, and then also to compensate for that with not the same amount of pay, with, as we all know, severe inflation, it's just not possible.
I've heard that story before, so thank you for, unfortunately.
May I have that way for a very long time.
I was just wondering if you think if there were incentives, like that forgiveness with people that, were in situations that would have been helpful, because I actually see going from 50 to 20% would maybe actually increase the number of veterinarians that feel they're able to do at least some large animal or mixed animal medicine.
I would agree with that it would get more applicants that would choose to go to rural areas as a result. Because what I'm experiencing and what I'm seeing in the different ways that I work with the university is that there are less and less people who are wanting to do large animal stuff. And so I think that will capture more
we're willing to try some part.
I was just gonna say, Albert, you've been running the diagnostic lab and I've interacted with you for, I really don't know many cases these days, but, I want to thank you for what you did and stepping up and running the diagnostic lab. That's a really good job. Personally, know that, but.
Any other questions for Albert? Thank you, Albert. for your update.
Little change in who's presenting today. Courtney Wheeler was unable to join us today, so I will be doing the presentation for her. So I'll try to answer any questions that come up, but I may need to defer some of those for a later response. So we're going over foreign animal disease preparedness and response, what it looks like for us, what we do, how we respond, and what our priorities are as well. So as most of you know, the main mission of the Board of Animal Health is to protect the health of the state's domestic animals through education and cooperation with veterinarians, producers, and communities. One of the ways that is done, we do rely heavily on practicing veterinarians and producers to recognize a lot of the diseases that may be out there. And on our website, we also have a list of all of the reportable diseases that need to be reported to us. They are on the drop-down menu up on the top right side, like red arrow. I don't have those all in front of us right now, but there's several ways that people can report diseases to us as well. So they can contact us directly. There are some of our field veterinarians that they can use, as well as the Minnesota duty officer that any after hours types of things. So. And like I said, accredited veterinarians are our first line of defense. They're the ones seeing these diseases, seeing the signs and symptoms before what we could actually see. So we rely heavily on them to report things to us. And several different types of lesions, signs, symptoms that should be reported to us in different species as well. They're depicted in the pictures here. So basically, what is a foreign animal disease? It's a disease of, it could be terrestrial or aquatic, that is not known to be existent in the United States or our territories. Some of them listed here, high-path avian influenza, which we haven't seen a lot of, but we do still respond to it as a foreign animal disease. We're still working on stamping it out, trying to get ahead of it as much as we can. We're also watching for African swine fever. That's been talked about quite a bit here over the last several months and years. Foot and mouth disease, which was a big issue in Europe several years ago. Rift Valley fever, something that we could be watching, could see in sheep as well. So things that we're watching out for. But like I said, it's the diagnostic labs finding some of these things, maybe on samples that are coming in, or veterinarians seeing signs and symptoms, reporting those to us. So when we do have a disease that has been reported to us, or something that's suspicious that looks like it may be a foreign animal disease, we employ what we call our foreign animal disease diagnosticians, or FADDs. Those are veterinarians that have gone through special training It's a 2-week training that is currently has been out in Plum Island that Dr. Schaefbauer talked about. Is that facility is going to be going away. It's going to be replaced by the one in Kansas. But it's a program to specifically train vets on how to recognize some of the diseases, what they look like, what samples to take, how to ship samples, all of those types of things. The training currently has been put on hold. We've had a couple people from USDA and the board that have been on the list to be trained, but with their continuing resolutions and their budget issues at USDA, they've been scheduled 3 different times now, and they've been rescheduled, and we're still waiting to see when the next one will be. So list of the veterinarians that we have through USDA and the board that have gone through that training. Located in several parts of the state, so we can respond fairly quickly to any of the diseases that we may need to be looking at. So what does it look like when we're notified of a potential disease? So what we do is it's reported to us. We then find a veterinarian that can respond, take samples, or at least get some more information on what might be going on. For number 2, then our goal would be to, if we do find something, to contain it as quickly as we can, as well as stabilizing the animal agriculture, the food supply, economy, and protect the public and health and the environment. So we look at a lot of different things when we're responding to these, and when if we would have any positives. We also look at the non-positive sites that could be affected or would be affected, not only for disease purposes, but commerce purposes, milk supplies, food supplies, those types of things. So like I said, when we do have something suspected reported to us, we have that assignment made to one of the local veterinarians that's gone through the training. The investigation is conducted. Samples usually are collected, and they may not be if some of the things that they see don't look like a foreign animal disease, but 99% of the time we are collecting samples. We also put a priority level to it. If it's highly suspected, if it's a low suspicion, high suspicion, it makes a difference of how quickly we want to get some of these samples to the labs. So the samples shipped for diagnosis, our shipping priorities could be altered with the different priority levels that would be assigned to that. Quite a few things on this slide, but basically what it's saying is if we have a suspected case, some clinical signs or epidemiological information that's consistent, in this case, ASF or African swine fever, we would get samples to our local labs, one of the NBSL or non-labs at the NAHLN lab, so that's VDL and the NPTL are considered those types of labs for a presumptive case diagnosis. We also would have confirmation done at one of the national labs as well. So here's a couple pictures of some things that we might be seeing that could be reported to us. The picture on the left is a vesicle on the snout of a pig, and some erosions on the feet and legs of a pig in the right-hand slide. Some of the samples that we'd be taking, we could be taking skin tissue, skin samples, tissue, serum, blood. We could be taking swabs from the nasal passages, fecal material. It depends on what we're looking for, what the potential disease is that we're trying to test for. We also would be taking multiple samples. So we take dual samples, one for our local lab, and then a second set of samples that would be sent for confirmation at the national lab. So then moving forward, if we do have a positive foreign animal disease at a location, there are several things that we take into consideration as well. So starting on the left, the biosecurity, that would be movement on and off of the facilities. So we don't want the disease to spread any further. We want to contain it as much as we can, keep it from spreading. Health and safety, that's where we bring in, like the Department of Health, where they're working with the responders, some of the workers on these facilities to make sure that they're staying safe, they're not contracting the disease, not spreading it as well. Personal protective equipment, not only for our responders, but for the workers on those sites and facilities to protect not only themselves, but it does also help with the biosecurity. So we don't want these diseases moving from where they were detected. One of the final things that happens would be the cleaning and disinfection of the facility and site that was affected. So that far right picture is a person spraying down a poultry facility to try to disinfect as much as possible. Quarantine and movement control on the bottom, that's happening as soon as a diagnosis is made as a positive. So the site that is infected would be quarantined, as well as potentially anything in that surveillance zone. So we've talked about high path AI with the different zones around. So those are quarantine and movement control sites. So they're permitted movements on and off the site for not only animals, but some of the products that might be coming off there as well. The system that we use to respond to this, it's an incident command system. It's a system that was developed by the fire service of California several decades ago, and it's been refined quite a bit since then. Pretty much any emergency response uses this type of a system throughout the country, and if not even the world. It's a top-down structure with the incident commander being the top of that, and then there's 5 management functions overall within that. So the incident command, logistics section, operations section, planning, and then finance and administration. Most of the boots on the ground, the people that you'd be seeing responding out to any of these facilities would be under the operations. So what's nice with this type of system is it can expand and contract as needed. So this is a very simplistic look of what it looks like. Our current incident command structure is much bigger than that at this point. So you could have, in the operations section, you may have 50 people or 50 different positions under that as well. One thing that is unique to Minnesota, as Brian mentioned earlier, is how we respond. We use what's called a unified command. It's not necessarily unique to Minnesota, but the way we structure that with our other agencies is a little bit unique. So we bring in the USDA as well as the Department of Ag with the board, with the unified command system. So we basically have an incident commander from each of those 3 different groups helping to manage the entire system or the whole structure. What's nice with that is, let's say, USDA can then work in their specific areas a little bit more closely, as well as like the Department of Ag, if they've got specific things that they're stronger at, or they've got more personnel that we can bring into this whole situation. We can work as a group, and under this whole system, it helps unify and have us work as one unit. What does it look like this last year? These are the numbers from 2023. We did conduct 102 different investigations with our trained diagnosticians over several different species, most of those being poultry and swine. Why does foreign animal disease matter? It's preparedness and response planning for foreign animal disease. Instance is crucial to protect not only animal health, but our public health, animal agriculture, the food supply, the environment, and the economy. So continuity of business is very important. That's something that we look at as well. And there are several different secure supply systems they're mentioned there in the middle of, with the continuity of business. So there's a secure sheep and wool supply, a secure poultry supply, pork supply, secure milk supply, secure beef supply, and there may be others as well. Those are, things that not only the board works on, but I know Minnesota Milk helps with those, you know, all the different commodity groups, have their say on what's important in those secure plans. So there are some resources that if anybody wants to, know more about how we respond, how the, US responds and what our goals are. There are through APHIS, USDA, there are a lot of resources. With that, I guess I open up to questions. I went a little faster than what was scheduled.
Brian,
Yes.
are we still having? Eric, are we still having a Seneca Valley virus and some of the pigs out there and having to go? It looks so much like foot and mouth disease.
It does, yes, that's what most of the swine investigations were this past year. Trying to think, it's been several weeks. I can't remember the last sample we had taken, but we did see more of that this last year. It extended maybe a little bit more than what we normally see. I guess it's still circulating out there.
In the slide where you had all of the animals and the different outbreaks that had been like looking to, I saw rabbits on there.
Yes,
Was rabbit hemorrhagic disease one of the things that have we had outbreaks of that?
we have. I know Dr. Barch could maybe speak a little bit more on exactly what was done on those, but yes, yeah.
A handful of positive cases here in the state.
Any other questions? Thank you, Eric. Smell lunch. Lunch
Yep,
must be
it's
here.
pretty much just about set up there, so,
And we'll be eating in this room.
yes.
We are set on time, so maybe we'll start back up at noon. We'll go ahead and get started, everybody. I know a lot of us are finished eating, but looks like Stacy is ready.
Good afternoon. My name is Stacey Eissinger, and I'm the new general counsel for the Board of Animal Health. So thank you for letting me do this inaugural presentation for you all. Can you hear me okay with the microphone? Okay. And please feel free to keep eating away at your lunch. So it's just going to be a lot of words, a lot of legal talk. So do what you need to do. But basically what I'm going to go over today is some of the broad strokes of what the rulemaking process looks like. So I just will give a disclaimer that it doesn't get into like the nitty-gritty details of every tiny little step along the way. It kind of just touches on the big points that the rule process takes. And so if you have questions, feel free to interrupt me or read it until the end. First of all, what is an administrative rule? So an administrative rule is a little bit different than what a statute does. The statutes actually give the Board of Animal Health authority to pass rules and approve of rules and have them go through the adoption process. And then the rule itself is actually more specific. So when it comes to the Board of Animal Health, it's going to be things that the board has scope and jurisdiction over. So animal health, safety, disease control, management, that sort of thing. So rules are more specific. Statutes are more particular than subject matter. So kicking off rulemaking can happen a couple of different ways. The more generic standard way is probably just the board recognizes that there's a need for a rule. And so the board determines that they're going to go ahead and kick off the rulemaking process. And then there's a path that it takes from that point. There is another way that the rulemaking process can at least be initiated. And that's through a member of either the public or an entity that wants to present a petition to the board. And how they do that is there's actually laid out rules in the administrative rules chapter. And it shows what needs to be put in the petition, and that's presented to the executive director of the board. And then after that, they have 60 days to review the petition and figure out what the disposition would be of whether or not they're going to continue on with proposing that rule through the rulemaking process, or for some reason, if it would be denied or shut down at that point in time, the reason why it's just not timely. But a couple of different ways that gets kicked off. And then once the board has determined that they're wanting to move forward with a rule, whether it be a new rule or an amendment to a current rule or even repealing a current rule, the first step is actually to approve of a resolution. And so what I've seen is previously, there's a couple of different routes that it can take. It's either kind of a blanket authority that's given to the executive director of the Board of Animal Health to go ahead and sign off through each of the rulemaking steps that comes up along the way. Or the board can just say, we'll go ahead and authorize you to approve of this step, and then we'd have to go back and get a resolution passed for the second step and so on. So it can either be a blanket, we're going to go ahead and say you have blanket authority for each of the steps, signing off on the different orders, notices, or it's just specific to each step along the way, and then we're going to reconvene and go over this again, and then give you the authorization for the next step before you can do it. So without having to say it, but I will say it, going through a board versus just a generic agency, and I shouldn't say generic either, a broader agency, it takes longer just because the board does have to say, we give you authorization to do this, and then you can proceed to the next step, versus at an agency where they don't have to go through that step, they can just continue on because the commissioner or whomever is at the head of that agency can just sign off without needing to do that step. Yeah.
Since this is called the Board of Animal Health, when you say the board passes the resolution, you're talking about the directors agree to a resolution and we pass it?
Exactly, yes. So the process is you, as the Board of Animal Health Directors, you pass the resolution in a board meeting setting. It's either a board meeting or a special meeting that would be called. And then you would have to pass the resolution authorizing the executive director of the board, so board staff, to be able to sign off on that process before you can move on to the next step. So yes, that's kind of.
Sorry to clarify that.
No, it's very important to clarify, because again, kind of like I said, if it's a typical agency where there's a commissioner who's in charge, then you don't have to go through that step, but because it's a board, there is a little bit more like fine detail that's added to the process. Yeah. All right. And so once the authorization has been granted or is going to be granted, the governor's office wants to do a preliminary review of what the proposed rule is going to look like. And so at this point, it's not the finalized rule. It's not even a really completely drafted rule. It's just more of an idea that we're putting down on paper at that point. So the governor's office just likes to be notified, okay, this is what we're thinking of. This is why we're needing this rule, and this is why it's come up. This is what we're going to have it look like as of right now. And so you don't need to wait for the governor's office to approve of the rule the way that it stands in order for you to move on to the next step. But it is a good idea just to have them notified, and then they're starting to take a look at it. The next big step of the rulemaking process is probably the biggest one, where you get the public involved. And so you are required to involve all affected persons as part of the request for comments period. And what that is you publish out in the state register that you're thinking about adopting a rule. So it's the notice of the request for comments. And so once that's published in the state register, people who are members of the public and affected classes are going to be notified that we're thinking about doing this. We want to have your ideas. We want to know what you think would work in this rule, what you don't think would work in this rule, and then the reasoning why. And there's at least a 60-day request for comments period that's implemented in the standard rulemaking process, just to leave enough time for us to be able to digest, us meaning the Board of Animal Health, digest what the comments are, and then figuring out how we want to move forward with how our proposed rule is going to look. Basically. There are a couple of other directions that you can go in addition to just publishing the notice in the state register. A lot of times there are rulemaking mailing lists that have already been built up. So the Board of Animal Health may have those, either mailing lists, email lists, trade groups that we communicate with that we think might be impacted by the rule that we're gonna be proposing. Also different news, press releases that we might do just to put that notice out there, because again, this is the stage where we're trying to get as much commentary as possible from people who would be impacted, whether it's in support or if it's for some reason because they think it needs to be adjusted in some sort of a way, so. The next step, while we're still gathering comments, is to actually put down in a document called the Statement of Need and Reasonableness, the reason why we're creating the rule in the first place. So this is probably the most time-consuming portion of the rulemaking process, just because you have to go through with a fine-tooth comb and explain why is this rule needed? Why are there not other rules that are already covering this? Or if there are, why is this different than those? And then just give your support and reasoning as to why the way that the rule is written and composed is accomplishing what you're wanting it to. And so the reason why you're wanting to do this while the comments period is going on is just because it might have to shift depending on if something comes out in the comments that we didn't really account for when we initially were proposing the rule or coming up with a proposal. And so again, we get to send that over to the governor's office. And then this time around, what we do is we send them the proposed rule that we have drafted after receiving the comments, and we send them that SONA, which is the Statement of Need and Reasonableness. And we do want to wait until they approve of what the rule looks like at that point in time before we move on to the next step, just so that we're not needing to go back and adjust things, because it gets harder to fix what the rule looks like after you start to kind of pass this threshold. So the governor's office takes a look at it and then lets us know within about 14 days whether or not we can proceed to the next phase. Another little thing to remember is there's the revisor's office is involved. And so the revisor is the body that makes all of the laws more uniform. So they look at the grammar and the language that's used and just make sure that it matches other statutes or other rules that are also published within our animal chapter, our Board of Animal Health chapter. And then they take a look at that and they give us a certification saying, okay, yes, this matches the right form that it's supposed to be in. After that happens, we also consult the Minnesota Management and Budget Office just to see what the financial implications are of a rule. And so sometimes local governments can be impacted by a rule or specific areas. So in agriculture, it might be farmers who are impacted by rules. So what they do is they help us just evaluate financially who's going to be impacted by this type of a rule. Once we go through all those pre-approval steps, then we can actually publish our notice of intent to adopt a rule. So another step in the notice period. So this gets published out into the state register. It's again alerting anybody who's affected or impacted by a rule that touches on the subject matter that this is going to go ahead. We're going to continue on in the rulemaking process. And the mailing list, the rulemaking lists are also notified in addition to having it published in the state register. There are 3 different paths that you can take with giving the notice to adopt. You can either say that you're going to be adopting the rule with a hearing, without a hearing, or you can say, okay, we're going to give you dual notice where you schedule a hearing, but then it ends up getting canceled if you don't receive enough requests for a hearing. So there's a few different ways that the end result comes to be. So with adopting with a hearing, the Board of Animal Health can decide, we just want to go ahead, we want to have a hearing because this is a very controversial subject matter, or for some reason, we're just wanting to be able to have that structure in the rulemaking process. So we can just choose to go and have a hearing. Another way that happens is if we have selected without a hearing or the dual notice, if we receive the 25 requests or petitions to have a hearing, then it bumps it back up to having the hearing. So it's almost easier on the outset to do the dual notice because at least you have a hearing scheduled. And then if you don't get the 25 requests for a hearing, then you can cancel the hearing. But if the agency for some reason or the Board of Animal Health for some reason wants to just continue on with the hearing, then that's when you do that first option. And then the hearings are actually done through the Office of Administrative Hearings, and there's an administrative law judge who would be assigned to our specific rule case, I guess you could call it. And so then they would do the hearing, which entails the Board of Animal Health explaining basically what's in the SONAR. So the Statement of Need and Reasonableness, explaining the why, and then the public has an opportunity to comment at that point in time. After the hearing is completed, if one has been done, then the administrative law judge assigned to the rule composes a report. And so the report analyzes the form and legality of the rule. And then that report tells the Board of Animal Health whether or not it's approved completely, approved in part, disapproved completely, disapproved in part, or if there are some technical changes that may need to be made. And so at that point, the board either decides that they're going to go ahead and make those changes, or if for some reason they're not wanting to continue on with some of the pieces that were disapproved, then they can remove that from the rule and then just continue on with the rulemaking process for the portion that happened. So just kind of depending on what the goals are and the timeliness of when different pieces of the rule should get implemented. And then the final time that we submit the rule to the governor's office happens after we get the report from the administrative law judge. And so it's been approved by the administrative law judge. We send that information over to the governor's office, and then they again have to approve it. And the reason why we want them to approve it this time around is just because at the very end of the rulemaking process, after you publish the intent to adopt, then they have a 14-day veto period. And so if it was to get vetoed at that point in time, it would be very difficult to go back and start the process all over again. So it's just best to wait until the governor's office has approved of it at this stage. And then just kind of more administrative. So one agency gets it, and then they push it to the other agency, and then it gets pushed out, and everything hopefully goes on its merry little way. But then there's just a little note about its 14-day veto period. And then once that has passed, then we actually finally get to publish that notice of adoption in the state register. And so at that point in time, depending on whether or not in the rule it's specified what the effective date is, the date that it's published in the register is the effective date of the rule. And then I just wanted to bring to your attention just a few other non-standard rulemaking processes. So there are a few different routes that you can take to get either an expedited process or exempt rules done. And so that's just going around some of the steps that I previously brought up. So sometimes you don't have to have a public comment period, or sometimes you don't need to have the veto period for the governor at the end of it. And so it just kind of depends on what these rules lay out and is specific to the type of rule that you're going to be making. So a lot of the time, how you figure out you're going to be qualifying for an expedited or exempt rule is the statute authorizing the rule itself is what tells you that. So one of the exceptions is the good cause exemption. And so that's one where there are 4 different subdivisions that you can look at to see if you qualify for good cause exemption. And then depending on those criteria, you continue on in the rulemaking process, either with or without the public comment period, and then either with or without the veto period. So a couple of those distinctions there. And then some extra resources. I did just want to point out that the statute section, if for some reason you're wanting to dig into this a little bit more, the statute section that covers state agency authority for rulemaking is chapter 14, and then the rulemaking process and procedures is in the administrative rules of Minnesota, chapter 1400. And then a couple of references for rulemaking guides. One of the 2 I used, it actually was a 200-page rule manual that I tried to parse down to these 10 slides here for you today. So, yeah. Any questions?
I have a question, and maybe you clarified this in the beginning and I missed it because I was eating, so I apologize.
No worries.
But, you know, so like for us as a board, legislatively, there can be laws that are proposed and then passed that affect our programs. So can you maybe clarify for our new board members, if that happens, how does that affect our rule, our rule making progress? If there's a law that is put in place that we as a board have to follow.
Yes.
How does that correlate with the rulemaking process?
So if it's legislature that's passing it, then that's a statute. And so the statute would be telling the board, this is what you need to make rules for, and this is the scope of what you need to make the rules for, and you need to make the rules by X date, basically. And so that's actually when those exemption processes come into play, is the legislature might be saying in a statute, in addition to making these rules, you can also use this exemption in order to pass the rules. And then the board comes into play because the board determines, okay, this is how we're going to write the rule, and this is how the rule is accomplished. What the legislature is proposing that we do, or demanding that we do, really, since we have to follow it. So did that answer it completely? Or?
I think so. We have quite a few new board members on our board that just haven't been part of that process. So it's a lot of information to
It is.
process.
Absolutely, yeah. And please feel free to email me if you have any questions and we can set up a time to talk to you to go more in depth. Just wanted to touch the overview kind of what the rulemaking process looked like, but there's a lot to it. So there's a lot more detail that we could go over if needed.
So one of my questions is, as board members with our various backgrounds and everything, we don't always know what rules need to be made and everything. So we do rely on staff to inform us that we need to make a rule for whatever reason. And then it seems like we're just here just to shake our heads and say, yeah, okay, let's do this. I mean, there's some of that unless somebody on the board really knows what's going on and wants to have a lot more information about it.
Yeah, and so I think that the bulk of your involvement is gonna be at the proposal stage. And so that's when you're determining, you're gonna vote, yes, Dr. Hayes has authority to go ahead and move forward with this rulemaking process. That's the point where like you'll learn more about why is this rule gonna be implemented or what's the reasoning behind it. And then you can ask questions. Also, as part of the rulemaking process, what I've seen being used with other boards is they have special meetings. And so it's a specific meeting related to the rulemaking process and the proposed rule to really dig into it and figure out what's going on with this, maybe get public feedback at that point in time and discuss it, and then have more information individually that way. So that you're in
But the board never meets to talk about any of these rules except in a public setting where the public can watch us meet.
For the board of directors, that's correct. Yeah, yeah, that is correct. It has to be an open meeting. Yeah, of course.
Any other questions? Stacey, since you're new, can you maybe give us a short introduction of yourself?
Sure, yes, I just joined the Board of Animal Health as general counsel about a month ago. And so prior to being at the Board of Animal Health, I was at a company, I'll say companies, but I don't say which company. I was at a company as an attorney editor and then reference attorney for about 5 years. And so it was working with research tools and researching legislation, so statutes, administrative code and that kind of a thing. And then also just assisting attorneys and practitioners with legal research. Prior to that, I was an associate attorney at a personal injury firm. And so that was right after law school. And then prior to law school, I was a police officer out in Williston, North Dakota. So kind of an interesting trajectory, but here I am. So yes, but I'm very excited to be back in public service and be working with statutes and definitely content that impacts more than just me. So really excited to be here.
Good for you and welcome.
Thank you. Appreciate it.
Any other questions? All right. Thank you, Stacey. Heather, there must be joining us online. Yes. Heather, are you there?
I am.
All right.
Are you ready for me?
I think so. Yep.
Okay. Let me get this. Okay. Can I share my screen?
Yes, you can.
Okay. So I am Dr. Heather Damico. I'm the senior vet in charge of the equine program. I introduced myself last time we were talking about this topic, so and I think everyone was there. This is just an update on our equine exhibition permitting process that Katie and I have been working on quite a bit, along with Eric, and just to let you know what we've been up to here. So just a quick review of where we started here. There we go. This is just a review of what we talked about, last time. Basically, the reason that we think we could use an adjustment here is there's a shortage of veterinarians. That makes it difficult for exhibition managers to find an official veterinarian for a normal permitting process. And the reason that we think we need that we know we need permits for these exhibitions are some of the common equine contagious diseases like equine herpes virus, equine influenza, strangles, some skin conditions like warts that are contagious. And then the size and impact of the Minnesota horse industry justifies the flexibility so we can maintain the continuity of business, but also highlights the importance of our mission to protect the health of Minnesota horses. So with an industry this large, you know, we need to make sure that everyone stays healthy so we can continue to carry on business as usual, but at the same time, require some flexibility when we're seeing shortages in veterinarians and things that are maybe making it difficult to continue carrying on business as usual. You saw this slide last time. These are some of those contagious equine diseases that we were talking about that we try to look for at equine exhibitions. And again, the shortage of veterinarians, we require currently that a veterinarian visits the exhibition at least daily and also when animals are admitted. These exhibitions are usually held in rural areas, and we allow a Category 1 or 2 accredited veterinarian currently to be an official veterinarian. We met with some members of the equine industry, some veterinarians and University of Minnesota Extension, equine and poultry, ironically. The equine poultry extension person, Abby Schuft, also is an equine exhibitor. She shows horses. So she has a lot of experience in that, and then also has helped us out with High Path. So this process, she's familiar with a lot of permitting and things like that we've been talking about. And I think they were very helpful. I think it was a great conversation. Katie and Eric could attest to that. And along those lines, during that conversation, I think we all kind of came to the same conclusion that traceability and then the ability to identify and send sick horses home are two of the main things that we're looking for, you know, in this permitting process, or what we need at these horse shows to help prevent spread of contagious diseases among our equine population in Minnesota. So we discussed some potential options for how could we facilitate some changes and make this easier for the equine industry while still maintaining our mission. And we came up with this, we called it a pilot program. It's not set in stone. It's not, you know, we don't have anything finalized yet, but this is what we've been working on. So the goals for this pilot program are to address the industry economic concerns with having to have a permit that requires an official veterinarian, adapt to the veterinary shortage, and then continue to meet the agency mission with a new approach to equine-only exhibitions, which would maintain traceability and maintain a veterinary presence during exhibitions. So during this development of the pilot program, we proposed a training program for equine managers, similar, not the same, but similar to like our poultry testing agent program, things like that. So to train people of what to look for, what the requirements are, so they can be a little bit more boots on the ground. And, you know, having more eyes is never a bad thing, and more education in industry professionals is never a bad thing. So Katie and I have been working with Equine Extension to develop this training program. And if they complete this program, which are some online modules, then we're proposing a variance to the rules as they stand. The responsibility of these exhibition managers would be to retain services of an official vet. They still have to do that. Ensure livestock buildings and exhibit areas are clean and disinfected prior to animal entry and between groups. Ensure sanitary conditions are maintained throughout the event, and comply with Board of Animal Health staff and official vets to ensure sick livestock are removed or quarantined, and act as a liaison between exhibitors and the board. They need to maintain records. That is still a requirement, and then walk through all the animal areas daily and contact the official veterinarian if they have any concerns. The animal record requirements. These are also, these slides are kind of a little excerpt from that training module that we're working on. Just as an example of some of the things that they're going to see too. So they will see those requirements for the manager. They'll see this animal record requirement slide that managers have to maintain those records for 5 years. And you know, these are requirements that we currently have, but this is part of the training that they need to go through to make sure that we're all on the same page. And then the responsibilities of the official veterinarian, and those with the asterisks next to it shows the things that are going to be a little bit different under this pilot program. So right now, the responsibilities for a veterinarian are to approve the cleaning and disinfection, inspect the animals on the day of admission, and refuse admission or quarantine horses showing clinical signs of disease or not meeting entrance requirements, inspecting all animals once daily, and contacting the board with reportable diseases, maintaining a list of animals needing removal or quarantine, and submit that to the Board of Animal Health within a week. So the reportable diseases, obviously, and the list of animals needing removal or quarantine still is going to remain with those veterinarians. But these other monitoring, you know, inspection type activities will be done by the manager. So this slide is also in the training module, just kind of as a highlight, because it seems to be a confusion sometimes with the exhibition managers. What is and is not an official veterinarian responsibility? So they're not there to help with the sick and injured animals, although, you know, they should have a veterinarian that's available to deal with that. But that's not part of our requirement to reduce the spread of contagious diseases and prevent those issues in our equine population. So the official veterinarian responds to contagious diseases to minimize that spread. And they can have any veterinarian. It could be the official veterinarian, but it's not part of their requirement, as far as we're concerned, to deal with the non-contagious illness and injury type situations. This slide's also on there as part of the training process. Again, when to call the vet. These are not all of the slides. These are just kind of an example. Some of the things that we would, you know, want them to know before they pass this module. There's also a quiz at the end. There's going to be some situations that they have to go through to make sure they understand the material before we allow them to potentially get a variance. So another slide just on things that they should be looking for. And also, if they have any questions at all, that is the responsibility of the official veterinarian to address those questions and concerns. I would say err on the side, and they'll be told too to err on the side of, well, I just don't know. Well, then call the vet. You know, if you don't know, that's what you're here for, and that's what they're there for, is to be able to answer those questions. And really, it's up to the veterinarian to make those decisions because they're the veterinarian. Any questions?
Heather, this is Erica. And this may be a question actually for Stacy, but if your pilot program is successful and we have to make a variance on an existing rule, what does that look like for us board members? Do we go through the rulemaking process on that?
That is definitely a question for Stacy.
I would say yes. If it's something where the pilot program is successful, after we grant a variance, then we can implement the rulemaking process to change what the program looks like and add language if we need to. So that's a conformity that helps going to be used. Yeah.
Which I think is for us part of the idea of creating the pilot program.
I heard you correctly that not only is it Board of Animal Health veterinarians go do this, or just any accredited level 1 or level 2 veterinarian can be that veterinarian, right?
For the official veterinarian?
Yeah.
That is an accredited category 1 or 2 veterinarian. So not veterinarians that work for the board. In fact, it's a conflict of interest for them to do that.
Okay. That's a side hustle I might do when I retire.
I don't know how lucrative that is, but you know, you do you.
Oh, no, I know. Swine veterinarian turned horse show lady. I don't know. That's the public meeting. I'm sorry.
Any other questions for Heather? Any questions? All right, thanks Heather for your update. Okay. Let's see. Yeah, ready.
Well, thank you for inviting me here today. Again, my name is Lucy Hunt with the Minnesota Department of Agriculture. And I'd like to share with you a recent, little overview of a recent exercise that we went through for cold weather swine depop. Cold weather was a problem. They didn't have very cold weather this time. But just to give you a little background, the Department of Agriculture is involved in supporting Board of Animal Health, foreign animal disease responses. So all of those items that you heard about earlier from Dr. Judd, those are things that will support the board. Historically, we've had I guess maybe more of an outsized role in the depop and disposal part of a response, mostly because the Department of Ag owns a lot of equipment for depop and disposal for both swine and poultry. So that's kind of where we come into the scene. Back in 2020, our producers led, very large scale depopulation effort when it came to COVID response and meat packing plants shutting down. The Department of Ag kind of oversaw a centralized disposal site for all of those carcasses. Back in 2021, then we decided to look at carbon dioxide as a method of swine depopulation, and we had a cold weather CO2 exercise, and this was a NADPREP funded USDA Farm Bill grant funded exercise. That went quite well, and in the next year, 2022, we also led another NADPREP exercise or NADPREP project using nitrogen foam as a depopulation method. So using all of that kind of background work, last year in 2023, we were with the board, the MDA and USDA, trying to really work on our African swine fever, our grand plan. So that was a little bit of a background for us, trying to get this all moving in the right direction. And the final thing I have up here is National Pork Board has been, for the last probably 2 or 3 years, they have been going around the country to different states, operating these full-scale exercises for depop and disposal. They use different methods and different resources for each state, and we are learning from their experiences in other states what we might use here in Minnesota. So we've got all of that background, and with that, we've built this library of what I call operational plans. You could best practices, guidance documents, anything like that. But these are just written documents that remind us what are the things that we are learning through all of these exercises, just to have something to follow the next time. Hopefully it's a long time between when we need these things, so we just little prompts to get ourselves back on the right track. We've got several of these plans written and available now. I've got them listed here. Water-based foam depopulation is kind of the one in the works, so we'd like to add to the library. And we've used this exercise to get the basis for an operational plan, what that might look like in real life. And the Emergency Disease Management Committee for swine, and we've heard about this before. There's a EDMC for the poultry side, and then one separate one for the swine side. And I co-chair the Depop and Disposal Subcommittee. So with that group, and of course, that's regulatory folks, that's a lot of our pork industry people and our academics kind of all coming together. We meet monthly to talk through some of the issues that come up. The Depop and Disposal is quite a dynamic subject, as it turns out. So talking through, this opportunity with the group, what they decided, pork industry decided that they would like to have something that was a little more practical. They don't want to have a lot of, more new research going on and stuff. So they were looking for something that we could use, say if there was an immediate need for swine depopulation. Dr. Hoefs was also on the committee, wanted to see something that was more, involving more of the response rather than just one little section of it. So what we tried to pull this exercise together was to use equipment that we already have in the state and also make it kind of a central hub for some other offshoot exercises that we could put together. So I'll just walk you through what we did. This is just a couple of pictures of what we have right now. This is, what's the pointer here? Just this middle button. Okay. So this is the inside of our CO2 trailer. You can see some of the inlets here. This is the midpoint gate, and this is our ceiling here for our dump trailer that the MDA owns for carbon dioxide. And here on the right, this picture is a new, what I call all-weather poultry foamer that we put into use all last fall. This is kind of a specially built unit that Minnesota has used successfully on birds, on bird premises for the last few months. And so we thought, well, what can we do with this? Can we use the same equipment? One of the things we don't want to do is just keep amassing more capital, because that means more maintenance. That means, just more cost for storage. So we're really trying to use what we have in a novel way. So we decided to combine the poultry and the swine equipment and try water-based foaming using poultry foamers in a CO2 trailer. So that was the basis for what we started on. Got day 0 here. When it comes to exercises, you can really play with time and it turns out even space. So before we started the exercise, I wanted to make sure that we made this part of a larger response. So we brought together case managers. We had our 3D managers here. We had our incident commanders, all of the folks that are the first on the scene, basically, for a real response. And we went through what paperwork needs to be filled out. We are experts in the poultry side. So what did that look for the swine side? Was the paperwork the same? Do we just need to switch out swine and poultry? Or is there something different about swine that needed to make sure that we covered and had ahead of time? So we talked through a lot of the different paperwork for both quarantines, for indemnity work. USDA has some templates out there already for some of these. We went through those and then just kind of talked through the process with our case managers and just got the kind of the juices flowing about what we might need for a real event. And so that was kind of just a couple hours. We just took a couple of hours out of our day to talk through the work that needed to be done prior. And our project day one, which was last Monday, January 29th, we went out to a field site. These pigs were made available to us by one of our industry partners. They had gone through a research project and were not going into the food system, the regular food system. So we had 240 pigs that were between 80 and 100 pounds ish. They were, in a regular barn, in a regular research barn. So we brought our equipment down to the field site. We set it all up as if it were, pretending as if it were an infected site, and wanted to make sure that we could make this all happen. Every field site is different, and so each time we go to a new place, of course, the traffic flow is going to be different. The placement of our machines and our operators is going to be different, and we wanted to make sure that we had at least one chance to practice what was happening there. So we mapped all of that stuff out and got all of our timing right. We had time set aside for loading animals onto the trailer. We had time to apply the foam. With some guidance along these lines. We're supposed to reach, when we fill a container with foam for water base, we need to reach basically snout level in 30 seconds and then fill up the entire trailer within 60 seconds. So we did have some parameters that we were trying to achieve. And we weren't really looking for a throughput. We were trying to put as many through the system as possible. So we broke these 240 pigs up into 4 groups and put them through individually in 4 rounds, and then composted the carcasses after. So just a couple pictures from the site. This is our trailer backing up to the loading door at the barn. We've got a kind of a guillotine style door that raises up on these trailers, so fairly easy to load. We have a little a pig ramp that goes into the barn so they can load on pretty easily. This is the inside of one of our enclosed trailers. On the right here, this is the foaming unit. We modified the trailer. We cut little hatches into the side of the trailer so we could keep this trailer heated. Again, we're concerned about cold weather work here in Minnesota. We've done enough of it to make sure to know what needs to keep unfrozen. One of those things that we know from the poultry side is making sure that our foam is nice and warm. And so we've got both an electric heater blanket around the foam tote, and the trailer is heated. So we've taken our lessons learned and put them into practice here. This is the foaming part of it. When we use these nozzles for poultry, we only use 2 lines, and we modified this so we've added a 3rd line in that so we can reach that 30-second and 60-second goal. And we were very pleased to know that this worked. We reached our goals for each of the rounds. So that was really nice to see that filled in the time. We do have one person up here just doing the timing and watching to make sure that everything gets filled. These are 3 other cannon operators up here at the telehandler. Safety, this guy doesn't look too safe here. So we're part of our operational plan is ensuring safety for all of the workers. These are contractors. They are all well trained in being tied in, so they're all tied into that telehandler. But we want to make sure that we're minimizing safety risks on all of our projects. This is the dumping part of it. You can see that an immense amount of foam is produced here. Exactly what we want for poultry, but when it comes to the pigs, it's just a little extra. It's a lot to deal with. So this was just a photo of the end dump trailer unloading those carcasses into our carbon field. Day 2, we decided to take a little closer look at nitrogen foam. I mentioned a project, a NAPREP project that the MDA did a couple of years ago with nitrogen foam. There's a similar project through the University of Minnesota. So Dr. Marie Culhane was heading up a nitrogen foam study. This is kind of at the very end of her trials with a different piece of equipment than what we used. And so we wanted to take that opportunity. She used 90 of these same pigs for her trial. And same thing, kind of setting up that flow. Where does the water truck go? You know, where do all the hoses go? How are we keeping our operators safe throughout the process? We did 3 rounds with the nitrogen foam. This was, and I don't think I have a really good picture of the system. It's just basically a 20-yard dumpster on a roll-off trailer. So a little more compact than our big semis, but they are trying to really optimize this new nitrogen foam system. And again, I should probably explain nitrogen foam, just to remind you, this is where we use a foam with a bigger bubble size. And instead, with our water-based foam, the idea is more of a suffocation. And with the nitrogen foam, the animals will pop the bubbles and breathe in the nitrogen to create anoxic conditions and deliver a humane death. So those are kind of the 2 differences between the methods there. This is their control panel and their water tank here. When it comes to water-based foam, we use about 500 gallons of water for each load. So 2,000 gallons for 4 loads. And with this one, I think they worked it out to be about 25 gallons per load. So quite a bit less, quite a bit of water savings, we'll say, on that one. This is the inside of the trailer. These units here, these are the foaming units. Here, these are oxygen sensors. They got down to 0.2% oxygen, so quite low. It's really nice to see. And my next slide is, so this is kind of think of it as a time lapse. So the bubbles, do you see how big they are? Kind of like a bathtub, bubble bath. So these really big bubbles out at ankle height from the sidewalls there. Then a blast of nitrogen, air lance, we'll call it, nitrogen comes out to pop those bubbles all at once, creating anoxic conditions inside. We have the truck open here for these pictures, but this dumpster is sealed by a tarp. So once these bubbles all pop, that's when the oxygen level drops precipitously. And then here on the right-hand side, this is just the leftover bubbles, and the animals are left inside to dwell for several minutes. And then we're able to move the trailer and dump it like a roll-on dumpster. So that's the process with that one. We also wanted to, with every good depopulation exercise, we want to roll in carcass disposal. There's always something new to learn. We've got our carcass disposal experts in the back of the room here, Terry and Brian, our SMEs. One of our side goals for this project, for the depop disposal project, is building up our statewide capacity for more subject matter experts on carcass disposal. So we've been working closely with the turkey industry and swine industry. The board had a a 3-day classroom offering last summer for compost SMEs. And we want to make sure that we can do a little bit of continuing education. So earlier, last fall, we put in another Mad Prep grant for to develop a kind of continuing education project, and wanted to invite some of the people who may be involved with that to come out here and get some field exercise. So they are field experience. So we had a little pre-meeting with, again, using this exercise as if it were a real event. And we got together with our contractors, with our training SMEs, with our compost SMEs, and talked through what you might need to order, how to calculate how much carbon you need, what kind of carbon you need, where we're gonna put it all, how we're gonna set this up. So just really talking through some of those technical elements of of composting. So here is, this is just a field adjacent to our pig barn. We built a nice base here. You can see this light color base. This is wood chips. And then we've got a layer of turkey litter on top. Just because it's cold weather, that's something that we've learned over the years to put a little extra heat in there to start off with. Make sure that we're getting our carcasses cooking quickly. And then a little bit of I guess I forgot I have a camera, I'm setting on my phone, but you can see here at on the right, this trailer dumping carcasses into this foamy area. The carcasses were then taken out of the foam and placed in 1 layer, 2 layers in this compost pile. So it was a really nice way for everybody to see the different, like kind of slower paced, very detailed way of seeing what the process is. Again, a safety recommendation is not to put white Tyvek people into a white foam area. It's very difficult to see the people here. So if we were, as we're writing our operational plan, one of the safety recommendations is going to be to wear a different color than white when you're working with foam. And this is just a shot of our capping material, the sawdust that we use to put over the top of the carcasses. One of the other things that we already have an operational plan for is decontamination. One of our biggest fears is for us as the state to be spreading disease. So we want to make sure that we know how to decontaminate all of our depot and disposal equipment to make sure that it's clean enough to get off the site without being a danger to any other Minnesota herds. We've tried this in cold weather in the past couple of years to some success. Cold weather is very difficult to get around when it comes to decon. This year, this day that you saw from the pictures, it was a beautiful sunny day. It was about 45 degrees. So we really didn't have any issues doing the decontamination work. We just followed our protocols and got everything off. We did do some swab samples on the equipment pre and post test, and those have come back negative. So we wish we had a little colder days. It's nice to practice with the nasty weather, but we're glad that it came out with positive results, I guess. And we also have decon set up for people. We want to make sure that our people are coming out of the clean dirty line, able to scrub boots, able to get out of their PPE correctly. So we have, this is another kind of MDA asset here, our PPE trailer. This is one of the pieces of equipment that we keep up in Morris. Well stocked, as you can see from the shelving there. And then, yes, that's just a little glimpse of the equipment. Here we are power washing some of the wheels. All the wheels were washed as they came off the site. we made a great big muddy mess of this, this once nice parking area. So, there's a lot to wash off with the warm water. And of course, washing out the inside of our trailer. Oh, I forgot to mention, we removed the ceiling for the trailer. We had a ceiling bolted in there for carbon dioxide. We want to make sure that there's small volume that we have to fill with the gas. But here we needed a larger space for the foam, so we took that ceiling off. So there's our nice clean trailer. It's now back up in Morris with the rest of the equipment. So I know a lot of people in this room and online here were at the event. We really appreciate everybody's attendance and input. We got the group together afterward, after the water-based foaming exercise at least, and walked through some of the things that people noticed from their various perspectives, things that needed improvement, things that we needed to write down, things that we needed to think about a little bit more when it comes to doing this in an operational setting. So that's all I have for you today, unless there are any questions.
Yeah. I just want to say that I did attend that, and I thought it was very well run and very well explained, everything that's going on and how everything's happening. And I can read the white a little bit different, but it seemed to take a long time to. I know we were measuring a lot of things for the first couple rounds, but I don't know what. When you're doing the composting, and those pigs were 80 to 100, I think they were a little more like 60 to 80 pounds. There were a couple hundreds, but it's 6 people arranging the pigs for compost. Do you have to do that, or is that because of the research? Because in a barn of 200, 300 pound pigs, you're not going to move them around like you know.
Yeah, that's a really good question. Dr. Hawkins is pointing out that we had to kind of manually move the carcasses one by one out of that foam lake. So one of the things that we talked about was how to reduce the foam lake. Maybe we dump the foam in one spot and then come back and dump the carcasses in a different spot and kind of reduce that fishing around for carcasses. It's dangerous under there. It's slippery. You don't know if you're going to be stepping on a carcass or on some ground. So there is an issue with that. These pigs were just a little bit too small to work with a grapple bucket on the front end loader. Normally, that's what we would use. They slip in really nice so you can do it with your heavy equipment. But yeah, that is definitely, you would not want to be doing that for, you know, any more than what we did today. That's really hard on our personnel, both physically and mentally. So we want to make sure that we're reducing all of those opportunities for managing carcasses like that. That was not ideal. I agree with you. And so that's something that we're, that's one of the reasons why we do these exercises, because that's not something we really thought about before. And now that we have that experience, we're able to make sure that we don't replicate it for the next time.
Very well run, and kudos to everybody who from the beginning got every step.
Yeah, we really appreciate you coming down. It was nice to have you there.
I also serve on the AVMA writing of the Depop, rewrite of revisions of the current Depop document for AVMA. And so coming here really helped to see.
Yes. AVMA has not approved water-based foam at this time. They are working on it for, I believe they're going to put out their recommendations at the end of 2025. Is that right? About right? What's that?
24 or 25. I don't know how long we have to write this.
I think it's 25. Okay. But anyway, they are gathering, data from exercises like this. And they've given us some strong indications that they are going to approve it. I I think everybody's fear is that something's coming off the table, and we don't want to make one method better than another, because there's a lot of different pros and cons for each one, and we don't know what situation we're going to be in. So we want to make sure that all of the doors are open, and we want to make sure that we're able to walk through all of those doors with the equipment that we have and the expertise that we have.
Just say, my understanding of what we're writing is more of a hierarchy of if you have to do depopulation. These are methods that we know work, are very high on the welfare scale and on the human, interaction, emotional scale and everything. So these are, and this is what we know and how to do it the best. All the way down to, we know this thing works, not pretty. And it's not maybe desirable, but we really can't say everything's off the table, because if we're in a bad situation, and we gotta stop disease, especially if it becomes a zoonotic situation, we're gonna take everything we can.
Yeah, definitely. And now that we know that we're able to kind of have some multi-purpose equipment, I think a lot of other states are looking to Minnesota as, leader of developing these things. What do we need to have on hand so that we could respond to poultry, to swine, and how does that all work? So these operational plans, I share these with the state colleagues. And at the exercise, we had folks from Iowa, Wisconsin, South Dakota, and even Manitoba come down. So we had a lot of interest from the region, a lot of other cold weather states, interested in figuring out what's the best thing to use and where the best investments they can make are. Just to have everybody together and have their input.
Yeah, go ahead.
All right. It's fun stuff to talk about, of course. No, but it was a good presentation. But so after we're at mortality and we're on composting, I know practice to speed up composting in cattle is to make an incision of some sort. And I was just curious, is it by disease? Is there risk reward of accelerating compost time if that happens? And you talked about grapples. That's what made me think of it. Like, is there very major risk for airborne, whatever? I just curious, my question is, does the disease change the composting method? Or do you think what you had here works for pigs of all sizes? And I was just curious how careful incision, that's the biggest thing that I thought of when you talked about grapples.
Yeah, I guess Brian would probably be better person to ask on the compost effectiveness. We've done composting, whole carcass composting on a lot of different weight classes of pigs, and we've never lanced them, opened them up. And sometimes we will try and make an operational plan for grinding and composting, which of course introduces that possibility of aerosolization of any virus. So we've done some work on that, on aerosolization. How far does that virus go? And is it still viable when it gets there? So that's kind of ongoing work that we've got with the EPA. And barring that, some of the newer research going on with composting is that maybe you start out with whole carcasses just so you can avoid any more fluid loss, we'll say, and keep it all contained under that cap. And then when you go to turn it, then maybe the time to do the grinding or more mechanical turning and get that second half of the composting process really sped up that way. But with these, I forget, Brian, how long do you think these are going to sit out there?
3 weeks to the fair. 21 days before the turn.
So 21 days, is that what you said?
Yeah.
21 days and then we'll turn them and then let it cook for another 14 to 21 days after that. So if we grind them, we can get that process down to 28 days, just like the poultry. So it's a little bit of a trade-off on the composting side.
Okay, thank you.
I got a little bit confused on the water-based foam. When you're talking about the nitrogen, is it, I mean, is it the same foam that we use in poultry, or it is? So then, as the Department of Ag, will you be looking at if this is an improved method of increasing your inventory, what we keep money?
It is exactly the same firefighting foam. There is some research going on now at Ohio State University to see which maybe brand or concentration of foam is going to be best for water-based for swine. But yeah, we carry all of that stuff, and we've got a 40 to 50 barrel inventory already. I am not sure I asked how much foam it took for this concentration. I don't have those numbers quite yet, but that'll come up in our operational plan as to how much water we need to have on hand, and how much foam we need to have on hand. That foam is typically reimbursed by USDA if we're using it for, for an animal disease event.
Yeah.
But this is our state foam that we're able to use for this purpose.
And from my farmer perspective, did your dump truck get stuck? Because looking at your picture, it's messy. I mean, all the liquid that you have there.
Great question, yeah. And that was, I mean, we could easily have for animal disease in spring and fall, right? So where is the best place to put, obviously the winter time, and when we were planning it, it was very low. So it was no problem, the ground was solid, but it's definitely an issue about where our traffic flow is going. At this farm, we were going to have to kind of just keep traveling over the same routes, but could we make a circle route and kind of make it easier on the land that we're going over, or how would that work? We stayed off the roads, the public roads at this point. We didn't get it, nothing got stuck. It wasn't quite that soft, but that's definitely something that we would like producers to be thinking about when they're planning their biosecurity, or they're looking at their farm, where do they want to go? So I want to take that decision off of us as a state and have the producers be thinking about that in advance, about what would be a good place. Where are the concrete pads? Where are the gravel roads?
I just wanted to point out, Lucy's a bit of a magician when it comes to taking these opportunities and putting them into an exercise like this. How much lead time did you have to organize all that you put into this? Was it even a month?
Well, the pigs were 8 weeks old, so we had about 4 or 5 weeks to.
Yeah, so when Lucy says, it was sub-zero when she was flying, remember when we had sub-zero weather in Minnesota? It was just a few weeks before that, and you did an amazing job squeezing every little request in that we could get into this. So it was kind of neat. Just people were just firing, hey, Lucy, can we do this? Can we do this? And she accomplished basically all of it. So it's crazy how much we can get done in Minnesota.
Yeah, and there's still more to come. I mean, I really hope to use this as a launching point for some of our other response, some of the other elements that Eric, you brought up earlier. How do we set up a control area, pretend the site is infected, set up a control area around it? How do you do sampling around it, using our certified swine sample collectors? And there's an endless number of drills that we can do for our whole response plan, kind of based off of this one exercise. So it's really exciting to have something physical that we can point to and say, this is going to be our test run. But yeah, really appreciate all the support from the board folks and USDA, all the help from my colleagues at the Department of Agriculture. So you've done overtime. So thank you.
All right. Thank you all for having me again today. I'm just gonna give a little bit of a poultry update, touch on a couple of the diseases actually that Dr. Rovira has already mentioned. And then I wanted to end just by getting an overview of the history of the MPTL before we head over to the lab, just to kind of see where it came from and where we're at now. So, Dr. Rovira mentioned that they did identify a case of mycoplasma within our turkey populations. So just so you know, according to our rules, Mycoplasma gallisepticum and Mycoplasma synoviae in breeder birds are reportable diseases in Minnesota. And I know I talked about this, I think, at our September meeting, because we had a broiler breeder that was identified with MS. But that's the rule as it relates to it. And it specifically says that, you know, flocks that are identified with MG or MS have to be quarantined and participate in either an approved salvage plan or be disposed of. And so on January 3rd, Stacy Pollock, our lab manager at the MPTL, walked down the hall and found actually all of us sitting in the conference room. We were having a meeting and said, I've got some non-negative results for Mycoplasma synoviae on a commercial turkey breeder flock. It was a 33-week-old flock that had just submitted samples for its routine monthly NPIP surveillance. Contacted veterinarian, the flock had not been experiencing any clinical signs. I requested that tracheal swabs be submitted from that flock, and they were submitted the next day just to verify. So with mycoplasma, sometimes the serologic testing can be a little bit hard to interpret, and so we would always like a second test just to verify. And 24 out of 24 of the tracheal swab samples were positive, so there was no question that this flock was infected. So the premises was placed under quarantine. There's actually, this is a hen flock, just essentially a driveway away, but it's a second premises is where there's a stud farm. So the toms that are associated with that flock, they were testing negative, but I placed them under quarantine as well, just as a precaution. So unfortunately that flock, as well as the hatchery that those eggs will be going to, lost their NPIP MS clean status. Because the turkey industry in general had been hit pretty hard with high-path avian influenza, we really did not want to dispose of this flock. And so I did work with the company to make sure that we were able to keep the flock and develop a salvage plan. And so on January 9th, we approved the salvage plan, and the measures that they wanted to put in place to prevent the spread were to start treatments with antibiotics on that infected flock. So giving turkey's antibiotics for mycoplasma doesn't make the mycoplasma go away, but it reduces the level of shed. And so they started antibiotics right away. They had a plan for segregating the eggs at the hatchery, and actually they were able to have, at the time of detection, there was other flocks that were feeding into this hatchery, but they were able to send those flocks elsewhere. So right now this hatchery is only receiving eggs from the infected flock. They have plans to bring a machine for dipping of the eggs, which is somewhat common practice within the turkey industry, where you dip in kind of an antibiotic solution under a certain pressure and temperature to also try to prevent any infection within the egg from shedding. They are planning on injecting the poults before they go out, and then I require that they notify all of the flock owners who would be potentially receiving these poults to let them know that the flock had lost its MS clean status, what to look for, how to report it, what to deal with that, so that they weren't taken by surprise if they received a flock that potentially is developing clinical signs. They do have a plan for monitoring the effectiveness of the mitigation measures, so they've kind of identified three commercial sites that they're going to be doing some routine testing on, just to see how well their mitigation measures are working. Myself and Jason Cater, who's one of our field veterinarians up in the area where this farm is located, went out with Dr. Reber on the USDA side, who's our area epidemiologist, last Thursday to conduct an epi investigation. So this flock actually moved from kind of the holding site
over into the lake site. And so we aren't exactly sure where the infection occurred at. And so we did investigate, visit both farm sites. No obvious findings were found. Overall, the farms, both were being managed in pretty well condition. Buildings are in good repair. So there's still a question about how it got in. The research allowed me to go into the birds. The birds looked great. And this is the best flock we've had in a long time, actually. And so that's good news. But they're still going to continue on with those mitigation measures. Questions on mycoplasma, otherwise I'll go on to talk about avian adenovirus. As this is brought up, avian adenovirus is a virus in the Paramyxoviridae family. And there is mention that there's like 4 subtypes of APD. I'm going to abbreviate APD. APD. It is a highly infectious respiratory disease, and it's called turkey rhinotracheitis or swollen head syndrome in broilers. And it does cause not just respiratory signs, but it can cause a pretty significant egg production drop. And that's sometimes the first sign that producers will notice with that. There's also evidence that it can infect pheasants and ducks and guinea fowl. So it's not just a turkey disease. It seems to be a all poultry disease. Avian adenovirus C is the one that historically we've had in North America, and that affects mainly turkeys. And then the A and B are associated with clinical signs in chickens and turkeys that are more typically associated with the variety that's been circulating within Europe. I should put the caveat on this in that I've yet to receive actually like official USDA documentation and reports on specifically what's happening. So a lot of this is kind of, I don't want to say rumor mill, but it's kind of, you know, what's being spread kind of throughout the industry. And what we're hearing from the labs and what I'm hearing from National Turkey Federation. And so that's how I've been getting my information on this. But on January 23rd, APV subtype B was identified in samples from both chickens and turkeys in Virginia and North Carolina. I think Albert mentioned that there's a subtype A that's being identified in California. I haven't seen that written down anywhere, so I didn't include it in my presentation. But to give you a little bit of the Minnesota perspective on this disease and why it's been so, I think, scary for the industry is that in the late 90s through the early 2000s, so we dealt with subtype C in Minnesota for about a decade. In 1998, there was a processing plant surveillance program that was put in place to just try to identify the scope of what it was, and 40 to 60% of the flocks were positive for APV. So it was a big deal in the industry. And at that time, there wasn't a vaccine available. And so I think with the University of Minnesota, they worked to develop a vaccine that was appropriate and targeted specifically for subtype C. Eventually, over time, a commercially available autogenous vaccine was produced, and vaccination carried, I think, through the late 2000s. Before that was kind of stopped. We continued to do surveillance of commercial flocks for APV until 2010, and then we continued on with just our breeder flocks until 2018. And at that point, you know, we might have seen small blips of potential suspect cases, but nothing like the same extent that we saw earlier in 2000s. At this point, I wanted to give you guys an update on it just in case something comes to head. At this point in time, I don't believe that we have any pneumovirus in Minnesota, but it might actually be too early. Albert mentioned that the testing that the MPTL does for avian metapneumovirus is specific for subtype C. They've been doing a lot of testing, but if we've got B or A in the state, we're not going to pick it up. And so I appreciate their effort that they're putting into that kind of a quick turnaround in order to try to make sure that we've got surveillance appropriate to detect all subtypes. So at this point in time, if I'm contacted about a respiratory disease or an egg production drop, avian metapneumovirus is going to be on my list of recommended tests to look for. But right now, we're also trying to determine if we need a more coordinated surveillance program, and so I've been working with Ashley Coles, with the turkey growers. I've had a conversation with the National Turkey Federation, and we need to chat with, USDA and the university to decide what our next steps are. What do we need to look for? If we find it, what do we do? Questions on diseases before I move into more fun stuff? I wanted to give you just a little bit of a history on the NPCL before we head over there. So as you know, and I've mentioned this before, the Minnesota Poultry Testing Laboratory is kind of a joint venture between the Board of Animal Health and the University of Minnesota. So this is the University of Minnesota building, but our poultry programs at the Board of Animal Health are operated out of that laboratory, including all of our National Poultry Improvement Plan activities. I found old pictures. So back in the day when the NPIP was just starting to develop, it was started in the 1930s, specifically looking for warm typhoid disease. That testing programs were being run out of the hatcheries themselves. So the commercial hatcheries, because they already had kind of a warm environment to process those samples in, they were doing that. So if you kind of look, you know, these are incubators, and they just kind of would put the samples right in there and process that. So much of the NPIP testing at that point in time was done not in an official laboratory, but at the hatcheries themselves. Then poultry testing activities moved around the state from 1954 to 1968, when the first building for the Minnesota Poultry Testing Lab was established, and it was founded on the south side of Wilmer. If you're familiar at all, apparently this building right here is where PetSmart is located. So if you drive south of town, it has the same address, and if you ask Stacy Pollock today, when you go over there, what the address for PetSmart is, she'll be able to tell you. And so this was actually an old Pfizer building, but if I have that correctly, the university purchased it for $1, from what I understand. And so they stayed in this building until 1968, when the building itself was just past its prime. At that point in time, so this was in 1997, the building that, this is what it used to look like in our current location, that is when that was built. And it was mostly to replace the aging facility, but also to expand the workload in modern technologies. In 2002, all of the board poultry program activities were moved out to the NPTL. So prior to that, they were handled in St. Paul, like all the other programs were. And then it was just the laboratory side of things that were managed at the lab. And then in 2007, they moved out of the lab and they did a renovation to accommodate increased testing activities. And it was that year, I believe, I wasn't able to get official confirmation on that, but the diagnostic serology testing for the BDL also moved out to there. So instead of just doing regulatory testing, they also offered them the diagnostic testing. If you wanted to check some titers, that testing moved out. So that all of the poultry testing was focused at the one building. And then in 2015, you guys maybe know this story, after our HiPAP event. At that time, the MPTL had no capacity to do any PCR testing, so it was only serology and some other testing. The university received $8.5 million to do an expansion of the laboratory, and so we moved out once again, and we expanded, and it went from 3,600 square feet to roughly about 12,000. And with that came PCR testing. So that's kind of the history that I just wanted to cover for you guys. Krista, I think, has some directions to get from here over to there. So you guys don't get lost. We'll probably then train. Welcome to Wilmer. It's a laboratory. We receive lots of samples, and so lots of producers from all over the state are coming in there all the time. So, you know, please take the precautions that you need to before going into your own animals to make sure you don't track something back in. I recommend that when you come over there, we have very limited parking on site. And so This is the MPTL building right here. This is the frontage road, you probably come down High Avenue. There's overflow parking here in the community center lot. So that's where we're recommending that you all park, and then we can walk around to the front of the building to get in. I didn't invite them, but they came. Questions?
Thanks, Shauna. Okay, what is our September meeting schedule?
Oh, April.
Oh, yes, April.
We already have.
But we have a date for April, correct? Yes, we do. So September. Do we have Dr. Fox on line?
Sure.
April is April 3rd. So September. So should we try for Tuesday? I mean, we don't have Brandon or Dr. Fox here, so,
You want to wait for April to schedule it?
well, maybe that still is kind of enough time, right?
Yeah.
So maybe let's do that. That they will start. But will you be here? Next, because that's a Wednesday. Well, then you won't be here, so it really doesn't matter.
Yeah.
Let's pick a Tuesday in September. And if they can't come, I won't be able to that week.
Later in September is probably, USHA is usually first part of September. So that's okay.
If we get too late into September, I'll be hard to stay. And that's, and maybe Steve. Gilbert.
What we chat, call that. Labor Days.
So maybe the 17th?
Yeah. Yeah. Probably the last.
Okay. Okay, we're picking Tuesday, September 17th, okay? I'm joining virtually.
Because that April is the time when you vote to keep the executive
Director and our officer.
Yeah.
We also have to inform.
Yes. Okay. Is there a motion to adjourn the meeting? There's been a motion. Is there a second? There is been a second. Any discussion? All in favor, say aye. Aye. Opposed, say sign. Okay, motion carries. Thank you, everybody, for attending.